Today, I talked to someone who wears a lot of hats, a cosmetic chemist, an MD PhD candidate, the chief product officer at HelloSkin, a short and long form video creator, and honestly, one of my favorite people I've had the privilege of getting to know. Carter Gottlieb, also known as Eviba Carter. And what sets Carter apart isn't just his resume, it's his relentless curiosity in an industry that is known for bending to hype, quick wins, and marketing gimmicks. I mean this when I say this. Carter is one of those rare voices who doesn't settle for what's good enough. And that's what makes him so special. He's not driven by profit. He's driven by genuine obsession to understand, to explore, and to push the science of skin, hair, and the dermatology field forward. He's the kind of thinker who looks at what exists today, asks why it exists that way, and then imagines what should exist instead. His content doesn't just hand you answers. It takes you on a journey through the dead ends and detours that most of us would stumble into on our own, but not have the strength or knowledge to move past, showing you how to find a better path that actually works. A lot like me, Carter doesn't just want good, he wants great. And in today's conversation, you'll hear why that mindset, paired with his depth of knowledge, makes him one of the most valuable voices in the world of skin and hair science. In this episode, we dive into the fundamentals and the frontiers of how to actually treat acne versus what's myth and what most people are doing that actually makes it worse, why sunscreen might be the single most powerful anti-aging tool we have, and why Korean sunscreens and other countries are so far ahead of what's available to us in the States, along with how to get them. What carotenoids and supplements can do to change the look and resilience of your skin, and how to separate big rocks from gimmicks in your routine. We get into the in-clinic treatments versus what you can do at home, the future of skin technology, and then shift into hair, breaking down what really works for growth and thickness from minoxidil to finasteride and even microneedling with the fundamentals most people miss, men and women. If you care about your skin, your hair, or just how curiosity and science can change the way we take care of ourselves, you're going to want to hear this. My co-host Mariana is out of town today, so this conversation will be just between myself and Carter. I don't want to waste any more time on sponsors or announcements, so I will leave all those notes in the caption so we can get into this conversation. Without further ado, this is Eviba Carter. Okay, so this will be a good point to actually start. This is a selfish question. I have an underground volcano forming right now on my face. This happens like once a month, and it's always before a day that I film. I know this is starting off on the wrong foot with quick fixes rather than building a strong foundation. I promise we'll get there. But is there really anything I can do to stop it or speed up its life cycle? Or is it just about damage control at this point?
I mean, it's mostly about damage control. You can try to put on benzoyl peroxide or like a sulfur spot treatment. But in general, I think with acne especially, it's something that you want to be proactive about. It's something that it's much easier and more effective to just prevent future lesions than it is to treat an existing one. You just kind of got to let it go its course. Some treatments might help a little bit. You can put on a little patch, put on a star on your face to cover it up. You can put cortisone injection. So if you go to a dermatologist, they can inject cortisone into it, which is a steroid, and that will reduce inflammation. In some cases, it can cause pitting, right? So you can get atrophy of the tissue there. So you end up with a little divot where you injected it. So I'm not a huge fan of that approach either.
I care about my appearance a little bit. I don't know if it gets to that point.
Yeah.
This is something that I actually argue my girlfriend with all the time. Now fiance, I got to get used to that.
Yeah.
Is it ever okay to pop a pimple? Like when it does come up and you see the whitehead, is it ever okay to pop it? Because I've always thought that it leads to something like scarring. And it will, in long term, stretch out how long it takes my face to heal from it. Is it okay to pop it? And please tell me not, because I'll lose that battle.
No, absolutely. It's complicated, right? Because if you're just like taking your fingers and you're squeezing it, you're causing a lot of inflammation. You can lead to more scarring. You can irritate the skin in a way that can cause more acne. So you, in general, don't want to do that. I think that people get confused because on one hand, they hear all the time, you shouldn't pop your pimples. It's so terrible. It's like the worst thing you can do is pop your pimples. On the other hand, we have Dr. Pimple Popper and other people online who are professionally popping pimples. But there's a little bit of a difference. And this is something that I want to make a video about is I use little lancets. They go into like a little plunger device that can prick your finger for diabetics to get a little blood on your finger. And they're just tiny little sterile needles. And I like to use those when I used to get acne before I started low-dose Accutane, pop my pimples. And the key difference here is you need to create an outlet. So you take those little lancets. I like to put my fingers on my face to stabilize it. I don't want to be shaking around. You have to wait till it forms a whitehead. You want to poke in the exact center of that whitehead, not deeply. You shouldn't feel it at all. If you feel any sensation whatsoever from that needle, pull it out. You don't want to go deep. And then once you've created that little outlet for the contents of the pimple to come out, you can use a little pimple extractor tool, and the key is that once you lance it, it should come out super easily, like very little pressure. So you're
Mm.
not causing a lot of inflammation. So at that point, it's okay to lance it. It can speed up the process a little bit, and I do like doing that. But I think the issue is that you can't just broadly tell everyone to start doing that. Or they're going to be stabbing their
Yeah.
face in ways that cause more damage than good.
I used to use them all the time before I have a CGM. Those
Yeah,
needles are tiny. I mean, maybe what,
yeah,
1 to 2 millimeters. Those little
yeah,
lancet needles are
yeah, yeah.
tiny. That
That's all you
actually
need.
makes a lot of sense, but I
Yeah,
feel like that would terrify a lot of people because they have an aversion to needles. But okay, so there
yeah.
you can do it, and it will actually speed up the healing process if you do it right.
A little bit, yeah. Yeah, a little bit. I think it's a good thing to do if you're trained on how to do it properly, which is the big if here, I think. Yeah, and
Okay,
one of the
big
reasons why, I wanna make a video about this, I wanna share this technique. I want more people who are going to be popping pimples, no matter what, to be doing it in a way that's not gonna harm their skin as much, but then there's always the risk that people are going to misunderstand what I'm saying and do it wrong. So that's something that I'm struggling with.
dude, some of the girls out here are addicted to popping pimples. It is the most ridiculous thing in the world. I don't know why I get
Yeah,
grossed out by it. I don't know what it is. It's something psychological. Like, you know
yeah,
what I'm talking about? People have an
yeah,
addiction to it. But back to one thing that you did mention, those little stars, those cute little
yeah,
stars people put on their face. I kinda had thought they were a little gimmicky. I didn't know if they
mhm,
actually did. What are they? Hydrocolloid stickers.
mhm,
Those little star ones that have kinda popped off on TikTok.
mhm.
When would you use them? Are they actually useful?
Yeah, I think they are useful. In general, like occlusion with hydrocolloid is going to accelerate wound healing and reduce inflammation and strengthen the barrier after, there's all this inflammation in the area. And so I think that can be helpful from that perspective, but also because it covers your pimple so that you don't try to squeeze it or mess with it. And I think a lot of people know they shouldn't pop their pimples, but they have problems with self-control or mindlessly as they're working, they're just kind of popping their pimples or whatever. And I think that
Mhm.
hydrocolloid patches can help prevent that. Just as a band-aid prevents you from rubbing up your cut on, something exterior. So I think they are helpful. I don't think Starface is the best brand. I think other hydrocolloid patches are better, just the simple round ones. But Starface is good because it's popularizing them, and I'm happy for that.
It's almost like one of those dog cones on their head, like, just gets them to stop
Yeah,
touching
exactly.
it.
Little dog
Just
on, yeah.
I don't know. That
Yeah,
might not be accurate, but that was a selfish place to start. But I'm curious because I know that, most of what you talk about online, I mean, it does go in a lot of different directions, which we will today, but it is skincare and skin health focused. But I've heard you talk about what got you into this initially, and I am curious, was it acne in the first place that got you curious about this just space as a whole? Or how did you become, I mean, you today?
yeah, exactly. My interest in medicine, so there's a few key moments in my life I think that drove me towards this path, but a big part of my interest in just, like, evidence-based skincare was my struggles with acne in high school. So, I had a lot of acne, and the treatments that my mom were buying me just weren't working, and so I just looked for research papers and found the evidence-based treatments, benzoyl peroxide, adapalene, and these things just as long as I used them, just pretty much completely cleared my acne, and I was suffering for so long, and then the problem just went away, and I just saw the potential of just looking at research and seeing what has been shown to work and using that, and it's a simple concept, but not a lot of people follow it.
How old were you when you did this?
I was a teenager, 14, 15. Yeah.
It's rare today, but I'm like, even more rare for a teenager to be like, what does the research and evidence say about this topic? Because
Yeah.
I've found myself there in my later 20s, like even in just dealing with type 1 diabetes, when you get diagnosed, like there's a basic, very overgeneral care. I feel like that's with a lot of people who go through like an autoimmune disease or really any specific problem. There's almost overgeneralized information that doesn't work that well for a lot of people.
Mhm.
And sometimes it drives you to dig and figure out what else is out there because it's not just presented to you. I'm just imagining 15-year-old you do it. How did that transition into not just, okay, I solved this problem for myself, but the interest in dermatology as a whole?
I think that it's something that I was always interested in because of the skin, and then also we can talk about it later, but hair growth serum, right? In improving
Mm,
my hair growth and not losing my hair and becoming bald. And what I found was that there just aren't that many people who are very passionate about this subject and really able to communicate it well. Have a deep knowledge, a lot of
yes.
passion, and able to communicate it. So it's just a niche that I found I could be very helpful in compared to a lot of other fields of medicine where I think a lot of really talented doctors go into because they feel like they're, saving lives and they don't necessarily
Mm,
feel that treating skin conditions is saving lives in the same way when they're in medical school. as opposed to going down a surgical path or doing something else. And I feel completely different about that. I think that it's super important to treat people's skin concerns because of how important it is to their confidence and just emotional state. When I was in high school, I broke my two of my metatarsals, right? And so I was limping around in a cast and I was basically crippled and I had no anxiety about going to school in a cast. I was actually
Yeah.
crippled in that way, but when I had acne, like, I just didn't wanna show my face in public. I didn't wanna hang out with people. I wanted to be isolated, and it affected my confidence so much more profoundly and affected my quality of life, and I think that some people don't appreciate that. And if you can really guide people towards effective treatments that work, then you can change their outlook on life.
And this is what I loved in putting together just an entire outline, questions and everything for this, is I do feel like in the industry of fitness, health over here, there's a lot of overlap that I've noticed with skincare. It's different aspects of health, but there's a lot of
Yeah.
overlap in there. And I think that's why a lot of people get into fitness in the first place, is because they go through this change. They see a complete 180 transformation on just how they show up in the world because they're comfortable and just more confident in how they look,
Mhm.
which could be surface level, could be whatever, but it changes how you show up in everything. I hadn't noticed that. A lot of people talk about skincare. What drew me to you is you are I'm not joking, the first person that communicates it well. Why do you think that there's not really a space for that?
I don't know, a rare combination of talents. I think that a lot of people who are into science just aren't strong communicators, first of all. The camera stuff, everything that goes into production and script writing is also a completely separate skill. And I got into photography because my dad was really into it and it was fun to talk to him about it and
No.
and bond about it. And so like I got into cameras and then that led to this. And so I think that I had all the tools I needed to communicate the skincare stuff effectively. The medical education, the ability to communicate, ability to write scripts, ability to film and make good entertaining content and just be entertaining in general. I think that's important for
Yeah,
holding attention and making sure people understand is they're not going to understand if they can't even listen to you because they're too bored.
I call it the curse of knowledge because I
Yeah.
see so many fitness professionals who have doctorate degrees, PhDs in this field, and they just suck at communicating. I think this is why a lot of people connect to you, is because just like them, like if people talk at a PhD level in all this terminology that goes into it, the average person who doesn't obsess over this field, they're talking a different language. You know what I'm talking about? And so many people have
Yeah.
that curse where they almost automatically assume, oh, this is my baseline knowledge. Whoever I'm speaking to also has this baseline of knowledge. It sounds
Yeah.
silly, but that's how a lot of people act.
Yeah.
I'm curious even more. I mean, I'm sure you probably know of a few more in the skin health
Mhm.
industry than I do, like good communicators. Like there's got to be some out there, but there's just a lot that I haven't seen. And that's what drew me to you in the first place, because it is a different
Yeah.
skill set that you have to
Yeah.
get better at. And a lot of people don't think about
Mhm.
that. It is rare when you see both someone like you who's very educated, passionate, but also a good communicator. It's interesting to
Yeah.
connect dots back in life, like when your dad photography and things like that.
Yeah.
I think that's interesting.
I also think that it takes like a hell of a lot of time to write a simple script. Like, it would take me so much less time if I just kind of regurgitated all of my scientific knowledge on a camera, if I just had the camera up and started
True.
talking, but no one would understand that. Like, I have to write a script and then just whittle it down and think very carefully about my word choices to make choices that people understand, but also I don't lose any accuracy in my statements.
Mhm.
Blaise Pascal, the mathematician with probability theory and Pascal's triangle and so forth, he once said in a letter that he wrote, said something like, I'm sorry the letter was so long, but I didn't have time to make it shorter, or something like that.
I love that.
Yeah, I forget what the exact quote was, but he said something like that in the letter that he was sorry it's too long, didn't have time to make it any shorter. That's how I feel all the time. I'm always constantly spending so much time trying to shorten and make my scripts more understandable so that people, if they do commit the amount of time, they actually come out with having learned something and something actionable that can help their skin or health.
I'm 100% saving that to use in the future, because I even just gave a little talk to this business mentorship of a lot of fitness coaches
Yeah,
and showed them through my content making process. And I think you and I had talked about this a little bit, just how much
yeah,
effort goes into scripting that I don't think people realize when you can really make the type of content that connect
yeah,
on that level. It really is like, I truly don't think that you have a firm understanding in a topic if you can't simply explain it. But social media is such an attention game that it's almost a science in going down into it. I'm saying a challenge for you is when it comes to fitness and health, there's a lot of the more advanced terminology that people don't understand, but I feel like people's baseline knowledge for fitness is still a lot higher than their baseline knowledge for dermatology and skincare.
Yeah.
So you have to take them
Yeah.
from like ground zero and build this map to get them to understand. Some of these
Mhm.
videos you make are some of the most complex things in the world where I'm like, I feel like I have a very confident understanding in UV lighting right now, or whatever it might be at the
Yeah.
end. I'll have nothing going into it, which we can get into the content because I do love that aspect. And that's how I think we initially connected. But I'm going to ask this question like a dumb 5-year-old because that's how I feel right now. When it comes to skincare and acne care, are they essentially the same thing or do they diverge in approach? Or I guess in other words, should someone with acne just simply follow good skincare fundamentals, or do they need an entirely different regimen? I guess I'm just trying to understand how much treating acne is just overall skin health versus targeting something specific.
I think it can be both. Your skin definitely is sort of a window into your overall health. And it's important not to take this too far and, blame people or assume they have bad health because they have acne, because that's not always true. But in general, like if you suffer from obesity related metabolic syndrome, you're going to
Mhm,
have low grade inflammation. It's associated with a higher risk of acne. So just being healthy, being a healthy weight, taking care of your skin in general is going to reduce acne. But I think that also shouldn't be a reason that you don't treat your acne with
mhm,
the appropriate drugs. You shouldn't be like, "Oh, I'm gonna try diet for a while and treat my acne that way," because you wanna treat it as fast as possible so you don't end with a bunch of acne scars. And you can also
yeah,
improve your diet at the same time for long-term control, but I think that we shouldn't go down the path of saying, "Oh, you have acne because 'cause you're not healthy and you just gotta get healthy." I think that's a
mhm,
flawed way of thinking. Beyond that question, there are a lot of ingredients that are helpful for both acne and just long-term anti-aging. So retinoids are an example,
mhm,
tretinoin, retinol, adapalene. These things treat acne very well, but they also are going to be anti-aging for your skin and just health promoting for your skin in general. But something like benzoyl peroxide is going to be neutral to slightly negative for your skin, but it's going to treat acne really well. And there's still a use case for that because if you have acne, you really want to get rid of it as soon as possible so you don't
mhm.
damage your skin with acne scars.
I have quite a few questions on tretinoin because I feel like there is a cult-like following.
Yeah.
I actually saw it more for the anti-aging
Yeah.
community has this cult-like following to it. I then learned it was more of an acne medication, which is funny. I think most people it's the other way around, but we'll get to that. I like to understand problems kind of from a base because I think I'm wrong here and I don't fully understand where it
Yeah.
comes from in the first place. I think I, along with a lot of people, just think it's from a dirty or oily face that just clogs your pores.
Yeah.
But is the story more complicated than that? Like, is it bacteria, hormones, inflammation, probably a storm of things? I guess in simple terms, like what causes or where does acne come from?
It's a storm of things, as you said. And I think the most important thing to recognize here, which people don't understand, is it, for the most part, is not caused by dirt or oil on the surface of your skin. Acne is something that's happening inside of your skin. It's not because your skin is dirty. It's not because your skin is oily, really at all. Oily skin is going to be more acne prone because the oil that's being produced more than it should be inside of the pore eventually comes to the surface and you have oily skin and acne. But it's not the
Okay.
oil on the surface of your skin that's causing it or clogging that pore necessarily. It's going to be one, oil production. So excess oil production, often androgen related, hormone related, causes your sebacites to produce more oil and also oil of a different composition. And that is relevant in terms of how we can improve acne with taking omega 3s, for example. It changes the
Mhm.
composition of that oil a little bit. But the amount of oil produced and the composition in the pore, and then hyperkeratinization. So the skin cells around the pore form a little keratin plug that blocks the pore. And when you have these two things in conjunction, you have this keratin plug blocking the pore. And it's not like a dirt particle, right? That's blocking your pore. The skin should be self cleaning. And that's the thing that I think a lot of people don't understand is like the skin is constantly shedding. It's like a conveyor belt, just like throwing things off of
Yeah.
itself. It's self cleaning. So only when that gets dysregulated is it going to cause problems. So the pore closes up from this keratin plug, the oil starts building up, and then you have Cutibacterium acnes, which is a type of bacteria. It's anaerobic, so it doesn't do well with oxygen. So once that pore closes up
Mm.
and it's in an oxygen poor environment with all the oil that it can want, then it'll start growing. And the third thing that happens is a sort of an inordinate immune response to this bacteria. So this bacteria is part of our healthy flora, and we shouldn't necessarily form an immune response to it. But when we do, it can cause inflammatory acne. So there's the immune response to it, there's the oil production, and there is the hyperkeratinization that blocks the pore. And all three of them really have to happen to form inflammatory acne.
Okay. Correct me if I'm wrong. That bacteria is not necessarily a bad thing. It's just when it kind of gets
Mhm.
trapped down there. Is that
Yeah.
more
Yeah,
accurate?
it has to get trapped down there, and your immune system has to be reacting to it. It's not really a pathogenic bacteria, so in ideal circumstances, your immune system would just ignore it being in that pore, even if it was overgrown.
Oh,
But we have an immune response to that bacteria that is causing a local inflammatory response. So it's not because your skin is dirty, and I think that people end up harming themselves more than they're helping by excessively washing their skin when they have acne, because this can cause some
yes.
low grade inflammation. It can damage the barrier function of your skin, which can in some cases lead to more acne. Not always, but I think that kind of thinking leads to ways to treat acne that are ineffective. It's not really caused by dirty skin or oil on the surface of the skin.
Okay, 2 follow-up questions that I need to ask now. One, is that approach sounds completely counterintuitive to me. Is that counterintuitive for people who are just acne prone or just in general, that's not a great approach?
In general, I don't think it's a great approach. I think that the way you're doing it is right. I think that you should wash your face when you have something on it. If you have makeup you need to wash off, if your face is visibly dirty, then you can use a gentle cleanser to wash it off. I think that most people when they get into skincare, they cleanser is like the first thing they think of. They just that it's like synonymous with a skincare routine is you got to have a cleanser. And I think not
Yeah.
everyone does. I don't use a cleanser at all. I was never really able to fully control my acne until I stopped using a cleanser when I was younger. And I think a lot of people are in that situation. I think there are some people in some circumstances where cleansers work, but I think that the average person doesn't necessarily need a cleanser in their routine, and it shouldn't be the start of a skincare routine. I think that the core components of a skincare routine are going to be moisturization and UV protection. I think people really underestimate how well moisturization works to improve skin quality and for anti-aging. I think that just occluding your skin with like a Vaseline, a petrolatum, or just a nice moisturizer is going to do a lot for your skin.
That's actually the video that I think I discovered you with is when you had probably 2 pounds of Vaseline petroleum jelly on your
Yeah.
face years ago, I think is what it was,
Yeah, yeah,
which we're gonna get into because that was the best hook I think I've ever seen in a
yeah,
video, but it got me to watch because it flips the script completely. It's the
yeah,
opposite of what I feel like so many people think to be true. But I have, like, multiple questions popping up that I wanna make sure not to forget as we
yeah.
go along. I'm curious now, in that whole process, I guess it's probably oversimplified, but like a 3-ish step process that forms acne, how long does that process take start to finish? Like, if I feel this red monster coming out now, and I think it's gonna be there tomorrow, when did this technically start? Like, how long does that process last?
I'm not entirely sure about the exact length of that process, but it's definitely not something that just started the day before you got that lesion. So it's something that you should have been treating a couple weeks ago in order to prevent it.
That's what I was more
Yeah,
wondering. I'm like, it sounds like it's something that's a lot more drawn out than maybe
yeah,
a 24, 48-hour
yeah,
cycle. Now,
yeah.
I'm curious on this because when I grew up, and I really only struggled with acne when I was in my early teens, where I had to go to a
Mhm.
dermatologist because they were worried about scarring because of the excess amounts. I forgot what ended up actually treating it, but something cleared up, and I feel like my skin type's a little bit different now. You said that a moisturizing hydration
Mhm.
foundation
Yeah.
is one of your staples. I'm curious about skin health because what I've been told so much
Mhm.
is that everyone's skin is different and that it should be treated different for them. How much truth is in that versus like the same just general approach? Like if you have very oily skin, is that still as important as using things like moisturizers, hydrating, or is that something that you might not need because you have an excess of oil?
There are some cases where you want to personalize, right? So there's tons of different skin
Mhm.
conditions that have medications that treat them, and you wouldn't want to use them in everyone. But I think overall, most of the things that are good for the skin are going to be good for everyone's skin. I don't think people that have oily skin should skip a moisturization step. It's not
Mm,
going to cause any harm to moisturize. And oil isn't even the most important thing when it comes to skin moisture. If you look at young children, they have underdeveloped sebaceous glands, like in their nose and cheeks. They don't have these large pores and
true.
an oily nose necessarily, but they have really good, healthy barrier function in their skin that prevents it from being dry. And that's something that we want to encourage in adulthood is we don't necessarily need that oil to have moisturized skin, we need to focus on improving barrier function. And
Mm,
moisturization, the oil helps with that because anything you do to moisturize the skin, including the sebum that's produced by your own skin, including the moisturizers that you put on, are going to improve the barrier function of your skin. And that's really the ultimate goal. And that makes the skin less sensitive, less prone to inflammation, less permeable by things that may irritate the skin and cause additional inflammation and things like that. And when you have
okay.
inflammation, it leads to destruction of collagen through enzymes called matrix metalloproteinases, which break up collagen. So it's really more effective for anti-aging than I think most people realize. It's very important to keep the skin moisturized.
So how much of a different approach, like where does the individualization come from then in different skin types? I was hoping that's where it would go because I feel like that's where it is in a lot of things in life, where the principles, the foundation that gets you 80, 90% of the results are usually the same for most people. But that
Mhm,
individualization piece, where does that come from then on skin type? Like you said a little bit,
mhm.
where are those differences? Where do they show up?
It shows up in skin conditions. So if you have rosacea, for example, then you're going to want to use a medication that treats rosacea. You may want to avoid certain triggers for rosacea. Same with like eczema. So if someone has atopic dermatitis and eczema, then they might not want to be putting like high concentrations of glycolic acid on their skin because that could irritate it. And then also sensitivities. I think what our skin is sensitive to can vary a lot. And sometimes it's just trial and error. One, finding products that don't contain a lot of potential irritants, but also just trial and error finding ones that don't irritate your skin. So that's one thing in formulation that I look for is the lack of a lot of unnecessary ingredients. I really hate to see just
Mm,
a list of 30 different plant extracts in a product, just so many potential irritants in that. These things are not well characterized. They contain so many different chemicals in them. And I think it comes from this naturalistic fallacy way of thinking that's really misguided because as a plant lover myself, and you should see my living room full of luscious plants, like
it always looks like
plants
paradise.
plants don't have a lot of defense mechanisms. They don't have arms. They can't push you away. They can't punch you. They can't run away. They are chemical warfare specialists. They are making all kinds of secondary metabolites that are poisonous and toxic and irritating in so many different ways. And some of these things are useful because they may be targeting, say, fungus. They're making some chemical defense against
Mm,
fungus, and it's not uh, going to affect us negatively. But overall, if you're adding a ton of different plant extracts, they contain so many different things that at the end of the day are somewhat biocidal. They just irritate and harm anything because they don't want to be eaten. They don't want to be destroyed. So adding just a mix of 30 random plant extracts, I think is just a totally misguided philosophy. And I think avoiding things like that in skincare is important for everyone, but especially people who have sensitive skin that might react negatively.
Later, I was going to get into what red flags, because this is an assumption, but I feel like when it comes to anything beauty aesthetic based, skincare industry, there's going to be a lot of things that are just marketing and sales to grab you. Same thing in fitness, same thing in health, diets, supplements, whatever. Is that a big red flag you look for? Is generally this is the opposite of like more is not better. It's kind of the worst when it comes to this.
Yeah, I think that that's one thing, especially with plant extracts. I wouldn't say like a long ingredient list necessarily is bad as long as the things have low irritation risk. But when you're talking about adding a plant extract that could have, hundreds of chemicals in it, and then you add 30 of those, then you have a lot of potential irritants that is really unnecessary when we can extract some of these active ingredients from these plant extracts that we want to use as single agents and then just add them to a product. So, for example, like tea tree oil is very
Yeah.
antimicrobial, antifungal, antibacterial. It's great, but it also can be very irritating to the skin. A lot of people are sensitive to tea tree oil, and you can take the active component of tea tree oil, terpenin 4-ol, and you can add that to your product without all of the other random ingredients in tea tree oil. So you can selectively add these individual chemicals instead of adding all of them, and you can potentially reduce irritation risk without causing as much irritation. Yeah, so that's one red flag. There's plenty of other ones too. I think if you just lined up 100 random products that are just on the market right now, just completely at random, and you selected one, there'd be a 90% chance that that product was something I wouldn't want to put on my skin.
That's terrifying because I'm even thinking just from someone in my point of view, which I feel like I don't have a kindergarten level understanding of skincare and a good skin routine, but I'm definitely not as involved as you are. What are things that people should look out for? Because I feel like that is you're just blind walking in. Maybe it's just because I'm from the outside in. It seems like there's a lot more skin health products, like for your eyes, for your nose, for your pores, for your blackheads, for your like everything. Are you kind of a believer in just a simple, works better most of the time foundation when it comes to that stuff?
I'm more favor things that have a long history of use, a lot of high quality research. One of the things that I see now is just very poor quality research. There's companies that you can make a
Mm,
skincare product and you pay them $10,000 and they'll do some kind of study that looks kind of scientific, but yeah, but it's like not convincing to me. And it always really results positive once you pay them for it. Now that evidence-based skincare is becoming more popular, we see a lot of cargo cult science. And so I don't think that just looking for something that claims to be evidence-based is a good strategy, because now if you just look up like science-based, evidence-based skincare, you're still gonna lead you to products where they have really poorly designed the clinical trials. I think avoiding a lot of the new trends, waiting for these technologies and new treatments to mature a little bit for better science to be done, I think is important. But
Please
on the
explain that term cargo cult because it actually did a really good job of putting an idea that I feel like a lot of people are familiar with to a term. What is that?
It was a term that was coined by the physicist Richard Feynman, very famous physicist and lecturer.
Yeah.
And he coined the term because he noticed that in medicine, there were a lot of drugs at the time going through development and then ended up failing in the end. And a lot of the science that got people excited about it was what he termed cargo cult science, which is science that looks like science, but isn't actually real science. It doesn't have the same level of rigor, didn't do the right controls, things like that. He compared it to in World War II, after we colonized some islands in the Pacific, there was one island where they became accustomed to US troops coming down and bringing them cargo. So they would come and bring them food, they'd bring them all sorts of goods. And they really liked this. They started almost worshiping these planes that brought them these gifts. And
Mhm.
then when the US occupation ended, someone went back and noticed that these people had built like a satellite dish. They had made little like goggles. They were performing airport functions like on the runway. So to them, these people were doing something that looked like an airport but didn't function like an airport at all. It was fake. So they were trying to summon down planes, but really they just made something that looked like an airport but didn't function. So that's what he noticed was happening in some science at the time. And now I see stuff like that in skincare all the time. They do studies that look like science, but they just completely lack necessary controls. They're so poorly designed. They don't always show what they want to show. So, for example, like I saw one paper and it was comparing retinol to tretinoin. And there's multiple papers like this, and not all bad, but
Mhm.
this particular one was comparing prescription tretinoin to a retinol product that contained all sorts of other active ingredients that benefit the skin. And then they're trying to say that retinol is as good as tretinoin, is non-inferior to tretinoin. But really, they didn't compare retinol to tretinoin. They compared tretinoin to a whole concoction of things, right? They needed to have the vehicle be the same. So that's just one small example, but other things, there's just so many different ways that you can design a poor experiment that's going to show your product works better. Another thing that I see a lot now is in all sorts of microneedling studies where they will
Mm.
have a study where they compare a control group to the treatment group for whatever their product is, but then they say, oh, this doesn't penetrate well, so we're going to microneedle the skin to get it in there. And the problem with that is that microneedling has great benefits for the skin. So really, all of these companies, they just know that
Oh,
if you conduct a study this way, you're going to get positive results no matter what you really put on the skin, because the microneedling is going to benefit the skin. You can show that. You can make a nice little graph that shows that the treatment was better than the control, and you're good to go. You can put that on all your marketing materials. So there's a lot of ways that you can manipulate science to make it look like your product works when it doesn't. And I see so much of that in skincare.
that's an interesting concept, especially with microneedling, because that makes a lot of sense. I know we had talked about it, and I have some questions about that later because I started doing it on skin and hair. But are there certain studies that you see do it well? So, like in the microneedling example, will actually control for the delivery and say, okay, we'll just microneedle this person without putting any topical on,
Yeah.
compare results, or is that just few and far between?
Yeah, there are studies like that. There's definitely a ton of well-designed research. And that's sort of the problem is it's very hard if you don't have a lot of contextual understanding of the field to know what's missing in a study.
Yeah, that happens everywhere. I feel like when I don't want to keep relating things back to like fitness and nutrition and
Yeah,
health, but when it came just interpreting data, it's
yeah,
like reading another language
yeah.
almost. And it's not that simple. And this is where I'm almost hesitant. I don't know about you. When I post on social media, I always include links, PubMed IDs to like
Mhm.
specific research, but I'm almost hesitant to do that sometimes because I know that the general population doesn't fully understand how to read and interpret literature like that. There's a great book that I recommend to everybody written by Mike Matthews that teaches you how to better understand these things and hopefully do this. But I see people misinterpret it so much. And I feel like as a marketer, that's one of the hottest things to do right now is to use bad science as evidence-based because it's almost taught as something that you just don't question. We studied
Yeah,
it, we tested it, we know the answers, so trust us. And
yeah.
it's so easy to fake that.
Another thing that I wanna say too is, like, you don't always know what should be there unless you're familiar with the field. Like, being in the worlds of both medicine and cosmetic chemistry has really made me appreciate the level of science that's really required to convince someone that your thing works. Like, a lot of cosmetic chemists will defend a lot of the skincare science saying that, they don't have the budget to do these large FDA controlled trials or whatever. And that's true.
Mm,
They can't do as many
yeah.
people in their studies. But reading these studies where they do get drugs approved, both for skin outcomes and just any type of health outcome or whatever, and treating any disease, you really learn what's required. I mean, they're not doing more than they need to suggest that something is effective. And I think having read so much of this high quality science really makes me more skeptical of the lower quality science. And I appreciate that there's a lower budget when you come to skincare. We don't have these large government grants. We don't have these pharmaceutical companies that are going to invest millions because it's going to be a blockbuster drug.
Mhm.
But sometimes the experimental design is just so poor. Like, they design these studies in a way where it's like you could have done good science with less people, but you chose to do something so abstract and bizarre. Why did you do that? Why didn't you just, design the experiment in the normal way? And there's so many things that I look at and I see that.
You touched on retinoids, which
Mhm.
this is where I have a kindergarten knowledge on. Because I do want to talk about staples, like things that are big rocks versus little rocks, things that matter
Yeah.
not. Correct me if I'm wrong, but I feel like retinoids are usually what is just like a game changer kind of acne treatment. But I feel like I see a lot of anti-aging communities talking about them. And I'm not gonna lie, I'm not even 100% certain what the definition of a retinoid is. Like I'm familiar with tretinoin, which I
Mhm.
think is a retinoid, correct? Retinol, adapalene, which I think I've heard you talk about before.
Mhm.
How are these the same? How are they different? And are they a staple in something just for anti-aging skin health in general? Or is it like a specific treatment that you're talking about for something that if you have acne, it would be helpful?
I think retinoids are helpful for most people. So retinoids are vitamin A derivatives. So the active form of vitamin A in your body is called all-trans retinoic acid, also known as tretinoin. So when you're applying tretinoin, you're
Hmm,
applying the active form, and this is going to bind to retinoic acid receptors in your skin. So retinol, for example, doesn't bind. It has to be converted through a multi-step process in order to become tretinoin. So retinol is a retinoid that is a prodrug to tretinoin, and that's its mechanism. So you also have retinaldehyde, which is one step closer to tretinoin in this metabolic pathway. So it is a little bit more effective or thought to be. And then you have synthetic retinoids. So adapalene is one example of a synthetic retinoid. It is not related to the structure of vitamin A, but it is made so that it fits into the same retinoic acid receptors as tretinoin does. So it can have the same effects, except it's a lot more specific. So there's three main isotypes of retinoic acid receptor, the alpha, beta, and gamma. And the gamma isoform is the one that is most implicated in both acne and anti-aging. So people who designed adapalene, they're saying, hey, tretinoin is great, but it has problems. One, it's hell irritating. Irritated skin dries it out, and not
I've heard
always. And also, that effect goes away over time. So if you use it for a couple years, like your skin's not just going to be chronically dry, or not. It won't necessarily be. You can get used to it, and your skin's going to be perfectly healthy and happy. But with adapalene, they said, let's just make it so that it's more selective for the gamma. So it binds the gamma and the beta receptor, not the alpha receptor, which is the one that causes a lot more of the side effects. And two, they're like, hey, tretinoin, super unstable. So it's very photo unstable. Visible light, UV light, they'll just break the molecule up. Same with retinol. Retinol is also unstable in long-term like storage in a solution, which requires like complex delivery mechanisms to protect
Okay.
the retinol. And so they solved these problems by making a molecule that wasn't related, so it's a different structure. It's a lot more stable, and it doesn't just break up in long-term storage. It doesn't break up on your skin when it's exposed to light, and it's a lot less irritating because it's more selective for the receptor that works and less for the other retinoic acid receptor that contributes to a lot of the side effects.
Okay, so let me get this straight to see if I'm following you. Tretinoin, which is I've heard, and again, I don't know how much of this is like myths, overblown hype, whatever, that you typically go through like some sort of a purge. Because I'm curious
Yeah,
too to see to really get a better understanding and make sure I know like what these retinoids just even do.
yeah.
Like what are they doing that causes all this? What is it doing that makes your skin look better over time? So adapalene just seems like a newer version of tretinoin that kind of takes care of the side effects. Is it as effective? Is it less effective? Or is it kind of on par?
I mean, it really depends on the outcome that you're talking about. So for acne, it's less potent. So you need more of it to
Mhm.
have the same effect. But in most cases, for most people, it should be pretty much equally as effective as tretinoin. Although in more severe cases, you may respond better to tretinoin than adapalene. And what it's doing, it has sort of a multifaceted mechanism where it's reducing oil production, it's reducing inflammation, it is encouraging cell turnover and preventing the hyperkeratinization and forming of these plugs. So it really addresses sort of all of the ways that acne forms. So it's very effective. And now we have newer retinoids like trifarotene, right? And that's one that is very specific for just the gamma receptor, and it's much less irritating than the others. And we have really good evidence for that in acne, and we're still doing studies to find if it has the same anti-aging benefits. But adapalene has been compared pretty favorably to tretinoin in terms of the anti-aging benefits, and I think it's really underappreciated for that.
I had not heard about it before you. I just had heard
Yeah.
about tretinoin, especially when it comes to anti-aging. I don't know if I have the wrong idea or people do. From what I would guess, it's not like it will make you look younger than you currently are. I don't know if that kind of treatment exists or works, or maybe that's an
Yeah.
in-clinic treatment.
Yeah.
Does it do that, or is it more like kind of putting the pause button where if you start today, you're
Uh-huh.
burying a seed, where like 10 years from now, you'll notice, holy crap, I look like I've aged 1 or 2 years compared to, oh, I'm actually reversing my age. Does that
Yeah.
make any sense?
Mhm. Yeah, it's both. There's some nuance between like looking younger and looking better, right? I think that when we're talking about looking younger, there are a lot of things that age us, like bone loss in the face, these fat distribution, these things that really aren't going to be addressed by topical products. And really, I think the goal of trying to look like literally a younger age than what you are is misguided. But you can look better for your age. You can look more healthy for age, more vibrant, less wrinkles, less sun damage. You just look less battered, by
I've never
the
thought about it
elements.
like that. Yeah.
And so I think that should be really the goal, not to fool people that you're literally younger than your normal age, but to look really good and healthy for your age, and that's completely possible. So back to the tretinoin example here, both things occur. So once you start using tretinoin in a year or so after you start, you're gonna notice that your complexion looks a lot better, less fine lines and wrinkles. You're going to have reduced some of these signs of aging. Again, you're not gonna look younger, but you're gonna have younger
Yeah.
features, younger looking complexion. So you will notice that benefit, but I think the bigger benefit comes from long-term use, right? People that have been using tretinoin
Mhm.
for 10, 20 years, the trajectory is just gonna keep diverging further from someone who wasn't using it as you go on. So it's something that you really wanna be using for a lifetime, and I think you'll really diverge in terms of how you would have looked if you had never used it as time goes on.
So do you use or have you used tretinoin versus adapalene? Have you changed
Yeah,
your stance or where's your view
yeah.
on that?
So in my life, I've definitely used both tretinoin and adapalene. I've been using retinoids most of my life. I've alternated between them. I've also experimented using them at the same time. Not a recommendation, just was experimenting, right? Uh, but I think both are good. I think that adapalene is so much more accessible than tretinoin, and I think that a lot of people would benefit from using adapalene as opposed to like a retinol serum that they could buy from the store for anti-aging purposes. There's also prescription strength adapalene. I think these are all really great options, and it just depends on the individual how well they tolerate it. Some people can't tolerate tretinoin at all. Even small amounts of
Mm.
tretinoin will irritate their skin too much, and they can tolerate adapalene just fine. So there's access issues. There's irritation potential. I think getting on one of the retinoids should be something for most people. I think some people are intolerant of retinoids in general, and that's fine too. There's other things you can do for anti-aging besides
Mm.
retinoids. But for most people, if you go slow enough and you acclimate slow enough to the retinoids, you should be able to tolerate it, and it's one of the most effective things that we know of.
So not just for acne, but for just general skin health
Yeah.
overall. I hadn't thought about that before. I like that reframe of I always just assumed looking younger was the goal, not just healthier or better, which makes total sense in my brain.
Yeah.
I don't know why people don't talk about that more. Okay, so talking about looking healthier, I'm curious about what different components go into that. If it's not just controlling acne and complexion, what other aspects go into that? Because I know we're going to get into sunscreen. I also did get this one that you sent me, this Korean one, like a couple
Hey.
days ago, and I've been using it. We'll get into this more, but I'm actually kind of hyped about it because I'm curious why I actually use it. Not an adamant sunscreen
Yeah.
user, which
Yeah.
is a flaw,
Not
but I
yet.
feel like I've used 10 or so before. Well, I've used it every day since I got it.
Yeah.
And I don't know if it's this special brand or if it's something to do with it being not from America. It doesn't feel just like I have this oily slime on my face all day. That would
Yeah.
annoy the crap out of me. I'd use it for 1 or 2 days with every past sunscreen, and I'm like, "Okay, I'm only using this if I'm going legitimately out in the sun for hours at a time and can think about this." I've used this every day because I feel like my skin just feels like it's
Yeah.
moisturized almost. But we'll get into sunscreen because I know that's gonna be a huge foundational piece of all of this. I'm curious about looking healthy compared to just looking younger. What other components go into that?
There's a lot of things that go into looking healthy. One, acne, right? I think people generally associate that with poor health. Things like seborrheic dermatitis, which is caused by fungus, primarily Malassezia on the skin, atopic dermatitis, hair loss can give someone the impression of looking less healthy. That's something we can talk about later, but there's different types of hair loss, right? There's telogen effluvium, where if you have some sort of infection or you are protein deficient or deficient in a number of different essential vitamins or minerals, then you can also have hair loss. So hair loss doesn't necessarily mean you're unhealthy, but if you are unhealthy, you're generally going to get hair loss. And so that can be a big
Mm,
indication of someone's health. Damage to the skin. So a lot of sun damage that can look unhealthy. When we see sun damaged skin, we start seeing, especially as we get older, actinic keratoses, these crusty, scaly things that come from a lifetime of sun exposure. Perfusion to the skin is important. And this is something that I made a video about, where I take tadalafil, which is a PDE5 inhibitor, and also known as Cialis, right? It's the erectile
yeah.
dysfunction drug. And one of the things I started noticing, I took it for other reasons, but one of the things I started noticing was that my skin started looking a lot better. The blood flow
Mm,
to the skin seemed to increase and it had more of a healthy color. And I found that this is something that happens as we age. You start losing perfusion to the skin. So your skin is less blood rich and it looks like less blood rich and hypoxic, and it just does starts looking
yeah.
less healthy. And so there are so many components to how your skin can look less healthy as you age.
That's interesting that you noted that because it's become quite popular. Like a 5 milligram or a small daily dose
Yeah, yeah.
of medications like that has become popular because a host
Mhm.
of benefits, cardiovascular, I didn't even think about skin health, but that is interesting. I want to go into that later. When it comes to overall just complexion and a healthy looking skin, correct me if I'm wrong with this misquote. I think I've heard that you even said the best skincare routine, sunscreen is responsible for somewhat of around like 80%
Yeah.
of the result.
Yeah.
Is that a
Yeah.
misquote or is that something that's actually true? Because that seems
Yeah.
huge. And I know
So,
sunscreen's important. I know that's been hyped up. Is
uh-huh.
it that impactful? And if so, why?
So, yes, I think it is. I think 80%, we can't make exact numbers here, but, like,
Yeah,
yeah,
arbitrary for sure.
approximately, like, somewhere around there, 80%. Sunscreen and sun protection in general, not just the sunscreen, but other protective measures that you take is so important. Sun is going to damage a lot of the cells in your skin, damage the melanocytes, cause you to have hyperpigmentation. It's also gonna damage the collagen in your skin. It's going to cause so many different things that contribute to aging. You're gonna be wrinklier, you're going to be more prone to cancer, you're going to have less even pigmentation as you age, and a lot of the things that we do can only partially prevent or reverse this. So if it's definitely possible to, no matter what you do, if you're getting a lot of sun exposure, none of the tools we have available are going to be able to completely reverse or compensate for that. So really the best approach is just to get that damage in the first place. No laser or anything is going to completely
Mhm.
reverse that damage. So the best thing to do is to prevent it.
That's interesting because culturally, you and I had spoken about this when I noticed this at a trip to Japan. I noticed culturally just how different we are in viewing that, because I think a lot of people here love a tan. Like, they feel like they look healthier.
Yeah.
That's usually what I would see. If I see someone with just a natural tan,
Yeah.
I would almost assume that's like a healthier thing. But from like a dermatology standpoint,
Yeah.
one, is there really such a thing as like a healthy tan? I'm doing quote
Mhm.
unquotes. I suspect the answer is no, since a tan is
Yeah.
essentially just the skin darkening in a response to like damage.
Yeah.
But what do you tell like your friends, patients, people who insist on tanning? Like, is any amount of intentional sun exposure safe, or is it all cumulative damage in your view?
For the most part, it's cumulative damage. I think that there is some amount of sun exposure where it's like you're not necessarily going to have catastrophic results if you get a little bit. And there are benefits definitely to going outside and living your life to the fullest. So if
Mhm.
it's a trade-off between that and, getting zero sun exposure, I think it's good to go outside, just protect yourself from UV, but enjoy the sun as much as possible. If you are tanning significantly, then there's really no dose that is going to do that safely because that tanning is a response to DNA damage. You have to have damage to your DNA for your body to respond in a way that produces more melanin to protect yourself in the future. So there's really no absolutely safe way to do that. Although small amounts of exposure aren't necessarily going to, ruin your life or anything. So there's always a trade-off, and I think we don't need to be so extreme, but I think that
Yeah.
appreciating that any amount of sun exposure you get is going to contribute somewhat to cumulative damage is important.
Melanin, I'm curious, is it kind of like the smoke alarm, or is it the fire? Because I know melanin increases. I believe that's in response to the DNA
Yeah.
damage happening. I'm curious if you've ever gone down the route. I know a lot of bodybuilders will use, I believe the peptide is melanotan 1 or 2,
Mhm.
that increases melanin production naturally. Like, they take
Yeah.
an injectable, increases melanin. Is that per se bad because you can
Mhm.
increase the look of your tan there? Or is it the sun damage itself?
That's a really good question. So you're talking about, is melanin the smoke or the fire? Is melanin
Yes.
harmful?
Yeah.
That's a great question. In general, no, melanin is not harmful. Melanin is a protective substance. So it's much better to have higher melanin content in the skin. So people with
Huh.
darker complexion, there is a much weaker association between sun exposure and skin cancer. So people of African descent, the correlation is very weak between sun exposure and cancer. Um, so it is very protective and it's good to have melanin. The problem is being darker than your natural skin tone requires damaging the DNA to get that response to occur. Except, as you mentioned, if you use a peptide like melanotan. So we'll just lump these together, melanotan 1 and 2. But if
Yeah.
you, this peptide was developed at the University of Arizona by scientists who looked at people who were Fitzpatrick skin type 1, meaning super white people. They can't tan. Whenever they go in the sun, they just kind of burn, and it doesn't really matter how slowly they acclimate. But they were like, "Hey, these people aren't albino, right? They don't have
Mhm.
defects in the melanin production pathway that make it literally impossible for them to make melanin. They're just kind of not receiving the signal to get melanin." So they looked at what that signal was, and they thought about this hormone called alpha MSH, melanocyte stimulating hormone. And this is how the process works: is the UV damages the DNA, causes thymine dimers. You have a complex that goes and reads the DNA and signals this cascade that says, "Hey, the DNA is damaged. We noticed. Like, let's make some more melanin." And it goes to the melanocytes.
Yeah.
And so the melanocytes receive this hormone signal called alpha MSH, and then they produce more melanin, and then they distribute that melanin to the keratinocytes. So they have these long arms that kind of reach out to the skin cells and kind of transfer melanin to them. So you end up with melanin in your skin cells in that way. And they're like, "Hey, wouldn't it be great if we could just skip the DNA damage part and we just
Yeah.
give this hormone?" So from the perspective of the melanocytes, they don't know, what's going on. They just know that they receive the signal to produce melanin, and so they do. And this is interesting because it works. Like, you can inject this
No.
hormone, and the peptide hormone melanotan's 1 and 2, they are not exactly alpha MSH. They're modified mostly to be more stable in the body. So they have a little bit longer half-life, especially melanotan 2. So you can stimulate melanogenesis using this peptide with little to no UV exposure. And I think that's really cool. And I think that it got a bad rep because a lot of people were scared. One of the side effects of melanotan 2 is that it can darken freckles and moles. So from the
Mm.
perspective of a dermatologist, they're they know that if a mold suddenly darkens, that's a sign that it might be cancerous.
Yeah.
So there's dermatologists that go in and sampled a bunch of these moles that had darkened and found no cancer, but still kind of sounded the alarm and said, "Hey, this is a thing that's associated with cancer. We should pay attention." And I think the media picked that up and got really scared. But really,
Oh,
the whole idea of this peptide was to protect people who make less melanin than others. Fitzpatrick skin type 1, people of Irish descent that don't produce a lot of melanin. These people have very high rates of skin cancer. And perhaps by injecting this hormone, we could protect their skin. And this peptide is very pleiotropic. So there's a lot of melanocortin receptors. There's the one that makes you tan, but there's a bunch of other ones that cause all sorts of side effects. And melanotan 2 has a lot of side effects. The very serious ones, like causing cancer, are a little overplayed, but it causes like a lot of
mm,
flushing. So when you use it, like your skin gets red and hot. It can cause nausea. It causes yawning. It causes increased libido, increased arousal, which is an interesting part about it because they modified one of the pharmaceutical companies modified melanotan a little bit just so it still hit the melanocortin receptor that causes arousal, but less the one that causes tanning. And now that's an FDA approved drug, and melanotan isn't.
that's hilarious. That's so random.
Yeah, for hypoarousal syndrome, you can get basically a little modified melanotan too. So I have mixed feelings about melanotan too. I've tried it before, but the side effects are just a little intense. And also the way it makes your skin look isn't always natural. So when you lose a lot of melanotan too, your moles and freckles are going to get a lot darker compared to the rest of your skin. Your whole skin's going to darken even without any UV exposure. But the pattern's going to look weird. And if you suffer from melasma, it can exacerbate that. It just looks really weird and patchy. And to get a good result from melanotan 2, you really need a little bit of sun exposure. So
Mm,
when you do get that sun exposure, there is some synergy between the peptide and the sun exposure that gives a much more even tan. And that's basically why I'm not super interested in using it so much, is because I don't want to have to get sun exposure. Works without sun exposure, but just looks weird. And so
yeah.
I think that the type of person that is best suited for that is someone who really is going to get tan, right? Someone who wants to be tan so bad that they're going to go to tanning booths anyway, and that's
Mhm.
much more harmful for the skin than regular sun exposure. And someone who is going to get sun exposure, so like someone who is going to go to the beach without sunscreen and just kind of lay out and tan for a while, I think hypothetically they may be better off if they use melantan before they did that, to just bank more melanin from that damage that they're receiving to protect their skin in the future. And so this is something that isn't entirely worked out completely, but I think that that's plausible. So I've mixed feelings about melanotan too.
With the risk and some of these negative sounding side effects, is it that they're not that well understood and that's why they're a little bit scary? Or are they well understood? And I guess equally that's why they are scary.
In general, whether something causes cancer is kind of a complex question.
Yeah.
It it's very hard to make those causal conclusions about certain things. I think that it's likely protective against cancer, but that's something that's going to be have to work out. But it has been around a long time. A modified version of it has been found safe and for another use case. And so as far as peptides go, as far as a lot of these experimental treatments people are trying, I think there
Mhm.
is a lot of historical use of melanotan too, and not a whole lot of issues. So it's on the safer side of these kind of extreme biohacking things, I think.
So you would categorize it still as experimental at best, it sounds like.
Well, I mean, it's not FDA approved, so not that that is
Okay.
the ultimate. The FDA isn't always correct in their conclusions, and there are problems there, but it isn't something that's FDA approved yet. And part of that is just like being not tan is not a disease, so it's very hard to get get a new indication from the FDA for a disease that doesn't yet exist. It's much easier to say, "Hey, there's this disease that already exists, say acne, and these therapies are bad because of X and Y and Z, and I have this new therapy for this same disease that works better or has less side effects or something." And then it's an easier pathway to approval compared to having to convince the FDA that this thing you're even talking about is a problem, is a disease to even have an indication for. And so that was the thing with the female hypoarousal disorder, is there's a drug that was previously approved called a DE, which was controversial because it was really developed because SSRIs cause hypoarousal, right? They cause loss of libido, Prozac,
Yeah,
whatever.
you hear that all the time.
This is so they developed this drug that's like an anti-SSRI, basically. It has the opposite of effect of an SSRI, in with the intention of improving sexual function. So that is kind of problematic because there is some association now with this drug and depression symptoms, right? Because it's like kind
Hmm.
of the opposite of an antidepressant. And other than that, it doesn't work super well. So I forget the exact number, but it was something like in the clinical trial it was approved, this drug costed like $800 a month, and it improved like the number of sexually satisfying experiences by like 0.5 or something per month. So it's like you can statistically show that that works, but it's like not that good. There are side effects. It's super expensive, but they spent all this money, courting the FDA to get this whole new hypoarousal syndrome disease, even to get an indication for it. And that allowed bremelanotide, I think it's how it's pronounced, don't quote me on it, but the drug that is a modified melanotan peptide to be approved because it's like, okay, there's this existing disease. The current therapy on the market isn't that good, and they can show that it works better, and it's just like a much easier approval process than trying to convince the FDA that being pale is a disease in the first place.
Dude, tell the Jersey Shore tanning's not a disease. Funny story, just like literally 2 weeks ago, ran into the situation, Mike, at
Yeah.
the gym. And I don't know why I was so starstruck from the freaking
Yeah.
situation, like Jersey Shore, right?
Yeah. Yeah.
I don't know why I was so starstruck by this dude. He was just an icon of my childhood, but it was
Yeah.
so funny. Jim Jam Laundry. But I do want to say this. I don't know if it's a direct quote or correct me if I'm getting it wrong. This is something that did reframe how I saw not just skin health, but aesthetic too. You had said something along the lines of most people think skin color is on this one axis from pale to tan
Mhm.
or like the melanin axis. But there's another one, right? The
Yeah.
Retinol
You got a little
axis.
bit, yeah.
What is this? That's another one of those videos that you influenced me on. I now take a couple supplements for carotenoids, not just for what you were talking about, like the skin appearance, but I do like the underlying benefits, it sounds like, which I'm going to ask you to explain a little bit better from sun protection. What is that access? Are there more that exist for people that are unaware? Because I don't think that many people have heard of that before.
Yeah, so skin color isn't just pale to tan. It's not just melanin. It's also perfusion, as we talked about. So how much blood supply to your skin. Like when you're sick, you have less blood supply to your skin. You look pale. You look sick, and that's part of it. So your skin color is determined partially by the blood supply to your skin, but then also the carotenoid component. So when we eat a lot of fruits and vegetables, these things contain carotenoids, which are these yellow, orange, and red pigments that when we eat them accumulate in our skin. And this happens in flamingos, which are naturally white birds, but they eat a diet that's high in carotenoids and that accumulates in their skin and then gets into their feathers and then they're kind of pink.
Shrimp, is that what it comes from, or where does the pink come from?
I believe it's krill. I'm not an expert.
Oh,
I think they're filter feeders and they're feeding on krill, but I could be mistaken about flamingos. Salmon are the same way. Their flesh is not on their skin, but their flesh accumulates astaxanthin from their diet, and that's why they're pink. And the same thing really occurs in us. When we start eating more carotenoids, it changes our skin color. And so I've seen people in the past popularize carrot tanning where they say, oh, eat like a carrot a day or 8 carrots a day or whatever to get a tan. And this is not great for two reasons. One is like the bioavailability of eating raw carrots, like the carotenoid bioavailability is low. Two, there's just like not actually that much carotenoids. It's not that good of a source. Like sweet potatoes are much more bioavailable, have a lot more carotenoids than a carrot, a lot more beta carotene than a carrot, and it's more possible to change your skin color there. But two, the color you get, which is sort of yellowish orange, is not ideal. It can make you look kind of
mm-mm.
jaundiced. So people that do just eat obsessive amounts of carrots or just like insane amounts of sweet potato, they can tend to look kind of yellow, and that's unappealing because it looks like you're jaundiced, you know? It looks
It
like
can
you
really make that big of a difference. Like you would notice how someone looks like that, though.
Oh, for sure. If you just like take extreme doses of beta carotene, it's very noticeable. It can look pretty extreme. There's some extreme cases of
Wow.
that. And so I think this is why this idea wasn't more popular because there have been tanning supplements in the past where they added a lot of beta carotene. And I think there are potentially health risks to very high amounts of beta carotene. That's another issue. But the second issue is that it just doesn't look that good. Like you can change your skin color, but it looks bad. So what's the point? But I like to use a blend of carotenoids, including high doses of red pigments, astaxanthin, and lycopene. And I find that these red pigments, when mixed with, because I eat sweet potatoes, I get a lot of beta carotene from my diet. I also take these other carotenoids in the diet as well, and then I take these red carotenoids, and that shifts my color to something that I found was a lot more attractive. And it's almost like blending paints, right? Because you don't want any one color. Like there have been people that eat extreme amounts of tomato paste that contains lycopene, and they just become kind of a strange red. You want to really blend these colors together to get a natural appearance to your skin is what I found.
I'm gonna ask you the health benefits of this, because I believe you've talked about just the protection from the sun, like almost like an underlying,
Yeah,
not as even close to the same planet of
yeah,
the sun protection that sunscreen has. But still, it's interesting to almost think about it though. It's almost that outward signal. I don't know if it's an evolutionary thing or how much you believe in that, but almost like this outward signal of, oh, this person is healthy. They're eating a wide
yeah.
variety of healthy foods. That's what almost subconsciously you would think of. That's so interesting to me.
And there are studies that show where they show pictures of carotenoid color versus non-carotenoid colored skin, and they ask people of different races and things which one is healthier or which one is more attractive. And people just universally consider carotenoid coloration to be healthier looking. Melanin tanning is
Mm,
sort of culturally dependent. So
yeah.
in most African or Asian societies, when you do these experiments, you show people melanin tan skin versus non, they will say the person who has less melanin color is healthier and more attractive. But it's the opposite, or at least to a degree, right?
Mm,
Extreme paleness is not healthy, but doesn't look healthy. But with carotenoid tanning, it really, for the most part, doesn't matter. The majority of studies show that even people in East Asia or Africa, they consider both white people and people with black skin to be more attractive when they have more carotenoid color in their skin. And this suggests that
ah,
it is like a trophy. We're displaying the richness of our diet on our skin. And there was one study that also took these faces and they scrambled them up just so it was like wasn't a face anymore, just a mosaic of color because they thought,
mm.
"Hey, do people just like reds and yellows? Is it just like they prefer that
Yeah.
color schema to more blues and paler colors?" And so they just showed a mosaic of a face that had no facial features anymore, didn't look like a face, just a bunch of colors, and they found that people generally didn't prefer the carotenoid colored faces just as a color palette. So it really suggests that we're not really drawn to
Oh,
necessarily. They were trying to say that it might just be that in the context of a face, we know subconsciously, we know evolutionarily that someone with these colors in their face has a more rich diet and is healthier. And that could
that's
be,
interesting.
informing our decisions, and how we perceive people. So I think it's fascinating. I think that as we have started eating more ultra processed foods, carotenoid poor foods, we've lost a lot of these carotenoids in our diet. And now I feel pretty comfortable supplementing them and I've gotten really good results. I think people definitely noticed the difference when I started taking them. I noticed the difference. And like you said, there's other benefits to carotenoids as well. They reduce inflammation. They are very potent antioxidants, especially astaxanthin. So you're reducing oxidative stress. You're protecting your skin from the sun. You're protecting your other organs from oxidative stress and it has some benefits on heart health and other things, but that's not my area of expertise.
That's interesting to know that this is universally just something that seems to be the same, because my trip to Japan a few months ago, like I was telling you, it was a little bit jarring to see how completely opposite not all beauty standards were, but
Yeah,
just a tan. I feel like in America,
yeah,
people will do anything
yeah,
to fake a tan. In Japan, people are putting on excess makeup to appear
yeah,
more pale.
yeah,
The complete opposite, which was so interesting. And honestly, it seemed almost better guided because it does signal potentially better health just because you're spending less time in the sun, I'm
mhm,
wondering.
yeah,
So it almost seems like we've got it wrong, which is interesting. But it's cool to see that that's almost universally
yeah,
understood. Now, I'm curious. I think I bought lipozene and astaxanthin were the two,
mhm,
which I'm sure now I'm curious too because I just got these on Amazon. You're probably going to tell me these are crappy supplements as
yeah.
well. Is that as guided as like what we'll probably get into with this like Korean versus USA's sunscreen
Yeah.
branding? What do you want to look for those two?
With astaxanthin particularly, a lot of companies are faking their astaxanthin. It doesn't contain the amount listed on the label, and that's problematic. So I really trust BioAstin, and I've been to their farm, and I know everyone that works there, and they're a really great company. I think other standardized extracts are good too. So Astareal is good, and the Now brand uses Astareal astaxanthin. One thing to look for is going to be natural astaxanthin versus synthetic. Not that the synthetic astaxanthin molecule is any different than the natural one. It's just that when you buy a natural extract, you're not actually just getting astaxanthin. You're actually getting a whole bunch of carotenoids blended in that come because they take an
Mm,
algae and they do a CO2 extraction. And you're not just getting astaxanthin, but you're getting lutein, you're getting other carotenoids in there. And when we study these things, we give people these supplements and we're actually giving them a blend of carotenoids that come down in this extract. And it's unclear that the astaxanthin on its own is equally as effective as the blend that we get from a natural extract. And that's the concern with synthetic astaxanthin is like you are now just consuming astaxanthin on its own and you're not getting the
Mhm.
potential benefit of these other carotenoids that may be in the extract. The other thing is that it should be in a oil-filled soft gel. So it shouldn't be in a dry capsule for a couple of reasons. One is absorption. Astaxanthin is very poorly absorbed and some people are really poor absorbers and can't get the benefits because they end up just pooping it out. For me, I've never gotten red stools. It's a common side effect of taking carotenoid is
Really?
these
That would scare the crap out of me.
reddish stools, and some people are scared it's a harmless side effect. But what I've noticed from making a viral video about carotenoids and a bunch of people then talking to me about their experience, a lot of the people who say that the carotenoids didn't change their skin color noticeably were the same people complaining that their stools were really red. And
Mm.
I think that that's as simple as it's passing through you, it's just you're not absorbing it. So some things that you can do to improve that are one, oil-filled soft gel. Important for that reason, also important because the oil protects just like when you use WD-40 on like a metal fence or something, it protects it from rusting because that oil layer protects oxygen from coming to a contact with the metal. Same thing with the carotenoids is they oxidize very easily. And when you dissolve them in oil, they're less exposed to oxygen, especially in like a little sealed
Mm.
capsule. So the shelf life is longer as well. So you want an oil-filled soft gel and you want to always eat it with a big fatty meal. Don't just eat it on an empty stomach, even a meal that
Mm.
doesn't contain a lot of fat you don't want to eat it. And you also want to split it up as much as possible. So, breakfast and dinner when you're taking different carotenoids. So, take your astaxanthin in the morning, take your lycopene at night, take them both with a big meal. If you take two astaxanthin pills a day, then you might even want to take one in the morning, one at lunch, and then take your lycopene at night. You want to spread these out as much as possible as you can between your meals because there's a limit to how much carotenoids some people can absorb at once.
What's the dosage that you typically go for on this? Because I know that's probably equally important.
For a lot of the anti-aging benefits, and it depends on the carotenoid we're talking about, but let's use astaxanthin for example. I
Mhm.
think it's my favorite and just a highly effective carotenoid. So for like sun protection, 4 or 12 milligrams has been studied. And I think in that range, 12 milligrams is pretty ideal from an overall health perspective. But what I found was that if you really want to change your skin color, I personally had to take more carotenoids. So I take 24 milligrams of astaxanthin and 50 milligrams of lycopene, 50 or 40, depending on which brand
Mm.
is available. Because after I made that video, they started being sold out.
Oh, that's
So
funny.
so I'll take 40 or 50 milligrams of lycopene a day and 24 milligrams of astaxanthin a day. And that's my dose for skin color. But that doesn't mean everyone needs to take that dose. That's just the dose that I titrated up. I tried higher than that. I didn't really see more color change or more benefit. So that's just kind of the titrated dose that I landed on. But I think starting with 12 milligrams of astaxanthin and 25 or 50 milligrams of lycopene, that's a great place to start.
How long did you wait to see if you would notice these effects? Realistically, what would someone expect? Like, how long would you start a higher dose and be like, okay, it's been enough time. I would notice it by now if it had an effect. Let me titrate
Yeah.
back down.
It takes a while. Like, it can take definitely a couple months. I'd wait 3 months. With a lot of things, it's best to take a long-term approach, go slowly, make sure you're not having any issues, and just slowly go up.
I know a lot of people like this approach. I think everybody does. So you can find these in foods. The reason you supplement for them, is it just because it's almost unrealistic to get those kind of dosages or what would actually be necessary to make an impact through foods, like just
Yeah.
unrealistic? Or is it you just don't like those specific foods?
No, exactly. It would be unrealistic. I think that it's
Okay.
great to eat carotenoid-rich foods. I calculated at one point, it was like 2 kilograms of salmon a day or something I would have to eat to get this of, like, wild caught salmon a day I'd have to eat to get to some amount of astaxanthin is something insane and technically possible, but, like, not practical at all.
I remember doing that for creatines when I first started talking about this years ago. People were like, "You get it from red meat. You don't need a supplement with it." It's like,
Yeah.
my brother in Christ, you would need 5 pounds of red beef a day to get
Yeah.
5 grams of creatine.
Yeah.
I know it's possible. I don't think it's very realistic. So that was one thing,
Exactly.
'cause I know a lot of people like the more natural, can I get it through food? So it's one of those
Yeah.
gaps that just kind of exists.
I think that like, I don't take a specific beta carotene supplement because I also eat sweet potatoes like a few times a week, and I eat a lot of leafy
Mhm.
greens. I eat a lot of fruits and vegetables in general. But for someone who doesn't take those, it might be helpful to take a low dose beta carotene supplement. I also eat salmon, pretty frequently, and I eat other carotenoids in my diet. I think that's also important. Just eating a blend of carotenoids can influence your skin color for sure. You don't necessarily need to supplement, but to get the level of change that I got in my video that I made about it, there's just no way to do that with the foods.
It almost looked it looked so real, so you knew it wasn't fake, but your brain would try to convince yourself it was fake because of how
Yeah,
legitimately different you looked. I'm gonna get links from you after these 2 from some of your
yeah.
favorite brands. I know people are gonna wanna looking into this as well. But I do wanna move on to some fundamentals of
Mhm.
skincare, bringing it back down from everything we've started talking about. What would you say are the staple elements of a skin routine that everyone, regardless of skin type, should have? So I suspect sunscreen is one that we're gonna discuss, but what about
Mhm.
others like gentle cleansers, moisturizers, a vitamin C, a retinoid? I guess I'm basically asking for your desert island skincare picks, like that do the heavy lifting for most people.
Definitely moisturizer and sunscreen. That's something everyone should have,
Okay.
every skincare. And what moisturizer works best for your skin type can be a little bit of trial and error. I would avoid things that have, like I said, a lot of plant extracts. I would avoid things that have fragrances. There are certain red flag ingredients that I would avoid. But overall, I think a moisturizer and a sunscreen is essential. Everyone
Okay.
should do it. I think cleanser, some people should cleanse. Not everyone. I don't cleanse. I will cleanse if my face is dirty. If I have something on my face,
Mhm.
I'll use a cleanser to wash it off, but I don't do that every day. I think it's neutral to slightly harmful for the skin to cleanse. I think then after that, you have your active ingredients. And so if you
Mm.
just use sunscreen religiously, you're you're quite of the way there in terms of what changes you can actually make in your skin. But if you are someone who really cares about skincare and wants to invest, then I think using a retinoid is going to be your next step. So adapalene, tretinoin, retinol, retinaldehyde, use one of these. I think adapalene is a great place to start for a lot of people and really underappreciated. But as long as you're using one of these things and it's a reasonable formula, then you should be good. Other than that, vitamin C and tyrosinase inhibitors. People often think about anti-aging in terms of wrinkles, and I think that's misguided. When we look at someone's face and just subconsciously try to determine how old they are, a lot of that has to do with the pigmentation in their skin. Old people have much less even complexion. They have a lot more hyper and
True.
hypopigmentation. And you can look at a face from far away where you can't even see the wrinkles, but you'll be able to age that person partially from their bone structure and fat distribution, but partially because of their pigmentation. And pigmentation is something that we can address. And so I like using vitamin C or a vitamin C derivative in the morning, and I like using tyrosinase inhibitors. So those are things that inhibit the enzyme that is the rate limiting step for melanin production. And this tends to affect hyperactive melanocytes a little bit more than others to even out the complexion. Hydroquinone is going to be the drug version of that. So if you go to the dermatologist, you have a lot of hyperpigmentation, they'll give you hydroquinone. And this used to be over the counter in a lower concentration in the United States, but not anymore. But there
Mhm.
are a lot of other tyrosinase inhibitors available on the market. We have your Arbutin, your kojic acid. I really like resorcinol derivatives. So now there's one called thiamidol, which is very popular, but there's also hexyl resorcinol, 4-butyl resorcinol, phenylethyl resorcinol. These ingredients are just all-star, I think, tyrosinase inhibitors that really make such a huge difference for your complexion and how your skin appears, and they're so underappreciated. So I think more use of those, but then also vitamin C. And a lot of things like vitamin C and a lot of the other actives that we use in our skin, they are mild tyrosinase inhibitors. Vitamin C is going to protect your skin very well from oxidative stress, protect your skin from the sun, used in the morning. So if you're someone who's serious about skincare, I think moisturizer, sunscreen, a retinoid, and a vitamin C hyperpigmentation serum that contains both vitamin C and some kind of tyrosinase inhibitor that's stronger than
Okay.
vitamin C is because it's a mild tyrosinase inhibitor as it stands.
I was trying to race to put all these down. Okay, so big rocks, moisturizer, sunscreen,
Yeah,
which I wanna dig on because those will have the biggest impact. After that,
yeah.
tyrosinase inhibitor, vitamin C, retinoid. Out of the active ingredients that you had mentioned, which ones are prescription versus over the counter?
Prescription is going to be tretinoin, so the retinoids. Tretinoin is gonna be a prescription always. Adapalene is over the counter for acne. You'll never find adapalene in, like,
Oh,
an anti-aging product, even though there have been studies to show that it has anti-aging effects. You're not allowed to market a drug for an off-label use as the company that makes that drug. So you will see it in the acne aisle. It can't be marketed for anti-aging. It can't be marketed
oh,
for making your
interesting.
skin look better. It's just for acne. So you have to know to go look for that in the acne aisle. and use it for anti-aging. But then there's a higher concentration of adapalene that is available for prescription. And then there's also other prescription only retinoids that you can get too.
So there are options though that are
Mhm.
both prescription and over the counter.
Yeah,
If
yeah.
you
So adapalene's
start
one of
with
those.
like
So like 0.1% adapalene is over the counter, 0.3% is prescription. And I've seen very high concentrations of adapalene being used like compounded in very high concentrations, and some people find that effective.
if you're just someone who's looking at like dabbling into this, like not actively seeking out treatment, it seems like 0.1%
Yeah.
would be a
And
fine place to start.
I think if your outcome that you're looking for is anti-aging, I don't think that going beyond 0.1% is even going to be more helpful. Like with tretinoin,
Hmm.
using higher concentrations can make your skin improve faster, but it doesn't necessarily have better long-term effects. Even lower amounts of tretinoin. It's likely the same with adapalene, where if you have stubborn acne, where your acne isn't completely resolved at 0.1%, then in that case, you probably do want to go higher on the adapalene or go to a stronger retinoid than adapalene. But for anti-aging, I think just using something like adapalene 0.1% and just using that indefinitely for years is going to be a good result. And you wouldn't necessarily get a better result by increasing the concentration to the prescription strength.
Interesting. Now, talk to me about this sunscreen. Because I know you say like sunscreen moisturizers. I'm sure there's good and bad. Why do am I just noticed, is this placebo? Is this because I think it's like, oh, it's Korean, so it must be doing something better?
No.
Why did you recommend this to me,
Yeah.
this Korean brand?
And it's not just Korean. So I use this sunscreen. It is Korean, but just worldwide, there's a problem in the United States, which is that sunscreen is classified as a drug. So if you want to get a new sunscreen approved, like you see on the back of that, it doesn't say drug facts. If you look
Yeah,
on the
that's
back,
immediately I turned it over.
a US sunscreen, it'll have that box that says drug facts as if it were
Ah,
Tylenol or an antihistamine or something. It's considered a drug. And that is a huge barrier for FDA approval for new sunscreen actives. Most of the sunscreen actives that we're using now were developed in the 50s and 60s. So we're using extremely outdated technology. It's so backwards because you might think that like, oh, the USA is just being more strict, more careful, right? Not jumping the gun and approving these new actives that they have
I
in
can
other
see that
countries.
argument. Yeah.
But it is so not the case because most of these sunscreen actives that we have in the United States were approved so long ago that the FDA was just a shell of what it is now. And the requirements for approval were much lower. So we have genuinely like harmful actives that are technically approved, like Patamate O, that just like industry wide, we don't use them because they can cause DNA photo damage and staining of the skin. And like we just never use that in a formula, but it's technically approved, FDA approved, just because the barrier to entry was so much lower back when this was approved many decades ago. So the actives that are approved in Europe and in Asia, they are not less tested. They have more safety testing, more efficacy testing than most of the actives that we use in our sunscreens here. But it's just so hard to go through the FDA approval process. It was such a big problem that the Obama administration in 2014 passed the Sunscreen Innovation Act, which shortened the amount of time that it takes
Hmm.
to for the FDA to, because there's like a waiting list if you want to apply for FDA approval for
Like
something.
kind
So
of loosen regulations a little bit.
not loosened regulations, but kind of just encourage them, speed up the process a little bit. But
Ah,
what it didn't do is not make sunscreen a drug. And so in other countries, sunscreen, it's not like it's considered a cosmetic, but they generally have, after seeing the American example and how that didn't work, they made special regulatory categories for sunscreen. So in China, it's regulated as a special use cosmetic. In other places, it's called a functional cosmetic, where they have specific guidelines for what you need to do to approve a sunscreen. So it's not just like Wild West,
mm.
right? You have to show that it's safe. You have to show that it's effective for blocking the sun in order for it to be a sunscreen active. And so now we have much more modern filters. And there's so many problems with the ones that we use in the US. So one is most of them are not broad spectrum. We have one effective UVA filter, which is organic, right? Not mineral, which is avobenzone, which can be irritating to a lot of people's skin. It can be super greasy feeling. A lot of the other sunscreen actives that we have can be greasy feeling. They also have an odor. And I think not so much an issue for me, but an issue for adoption is that a lot of these sunscreen actives are absorbed into the skin. They get into your bloodstream, they get into your body.
Yeah.
I think there's not really a lot of evidence that that's going to be harmful, but still, it's a reason why people aren't using sunscreen. And the newer actives don't penetrate the skin in a sufficient way, so that they don't get into the body. They're also photostable. So sunscreen actives here in the United States, when you expose them to the sun, they protect you from the sun, but they also kind of break up, which can require other ingredients to stabilize it, making the formula more complex and just reducing the cosmetic elegance of the formula generally. And they're much more broad spectrum. So like bimotrizinol blocks UVA, blocks UVB, is non-irritating, doesn't get absorbed by the skin, doesn't cause acne, doesn't smell bad. And we have these so much better sunscreen actives. So it's not that people in Korea are better at formulating, like their scientists are just better
Yeah.
than our scientists. It's that our formulators, our chemists aren't allowed to use the good active. It's illegal to make a good sunscreen in the United
Oh
States.
my gosh.
And so that's why foreign sunscreen is so much better at this current moment.
That actually answered a lot. That's interesting. I've seen this a lot. I talk about the DSHEA, the Dietary Health and Supplement Act. It was passed under Clinton. This is in like the supplement industry that basically deregulated them to the point of where they are not considered a drug.
Yeah.
And it seems like a small categorical difference,
Yeah.
but the leeway it gives you to produce, and this is where I think a lot of the bad comes with the
Yeah.
supplement industry. I don't think, maybe now I'm almost reframing it to see like what good it has done in the supplement industry is it gives you the flexibility to test things out and like move the needle forward rather than just being stuck in one place. Like it comes with a lot of bad, right? Like there's
Yeah.
so many
Double-edged sword,
supplements that
yeah.
are just fraudulent. So interesting that sunscreen was considered a drug though. I mean, I was thinking in my head a couple
Still
of
is, yeah.
decades. That's like 75 years ago. Like it's 2025
Yeah.
that it was considered this. So the US, it's not that Korean sunscreen is special. It's just that the US is stuck so far in the past with this stuff.
Yep. We don't have access to the modern filters, and that's the problem. And a lot of people now, I see a lot of dermatologists, I even see politicians talking about this now, so it's gaining some traction, but I think that we'd be so much better off if we had better sunscreens, because that would encourage more people to actually use sunscreen. You know, the sunscreen that's gonna work to prevent cancer is gonna be the ones that you don't mind using every day, and we just don't have that here.
It sounds so stupid, but I just would quit using other sunscreens because it would
Yeah.
just make me feel gross and like sweaty, even though I was in like an air conditioned apartment.
Yeah, exactly. And so many times I have that conversation with people. They're like, "Oh, this is the sunscreen I use every day. It's great. Everyone loves it." And I'm like, just try this one." And they try it, and they never go back to their other sunscreens, because this is just so much better. It basically feels like a moisturizer, and it is a moisturizer, just one that blocks your skin. It blocks UV from your skin.
And you said, I don't want to pick on terminology here, use religiously. I forget. It was one of those two.
Yeah.
What does that mean when you're saying use this? Because maybe this is a guy thing versus a girl thing. I work in a pretty darkened office.
Yeah.
Compared to someone who might be working outside. I go outside a lot at night. I go on like longer walks and midday walks, things like that. Is this something that I really should be applying like multiple times throughout the day? Or if I put it on in the morning, how big of a difference is it going to make?
That's an interesting question, because it has to do with how much like you touch your face, how much you wipe it off.
Mm,
In general, you want to apply it every 2 hours. So for me personally, if you're in a dark room, you don't need to be applying it every 2 hours. If you're in a dark room, you're not getting a lot of UV exposure. If you're near a
mm,
window, not so much of a concern unless the light is hitting you. So if you have direct light beams on you, windows, glass just in general is pretty opaque to UVB, but lets a lot of UVA through.
mm.
So if you have sunlight that's directly hitting your skin, then you do want to use sunscreen in those situations. But just being near a window where light isn't hitting your skin isn't worth applying sunscreen, in my opinion. But anytime you go outside, whether it's cloudy, it doesn't matter what the temperature out is outside. Before you go outside, you should put on sunscreen every time, even if you're just walking to your car for 5 minutes and it's cloudy out. I think every single time you go outside, you should be putting on sunscreen, and that is going to have a really good long-term effect. But if you're inside, not as important. That being
Okay.
said,
But it really does make that big of a difference.
yeah. That being said, if it's better to just apply this every morning as your morning moisturizer, and when sunscreen just feels like a moisturizer anyway, doesn't bother you, doesn't irritate your skin, there's no reason not to put it on in the morning. You know, it's good for your skin, and
Yeah.
so that is going to be much better, even if you don't apply it, than not applying it at all. So even if you don't reapply, you're still going to get a lot of benefit from applying it once a day, but it's going to be better if you're going to be going out. So normally I will put it on in the morning and then be at work, and if I'm going to go walk to a restaurant or something, I'll apply it again before I walk to a restaurant, before I go outside again.
Okay. This needs to be the next Eviba product.
Yeah.
It's like one of those I'm thinking those like clip-on keychain versions of sunscreen, because it does seem like something you're going to need throughout the day, not just something that should be in your like master bathroom to
Yeah.
make a difference.
Yeah. So I always got sunscreen in my backpack, but if a little fanny pack, a little strap might be good. Little like
Seriously.
thigh strap, maybe just modify one of those pistol holsters. or something with sunscreen.
Strap.
Strap,
Sunscreen.
dude. Yeah.
SPF. I want to go into the moisture part. So the sunscreen part's important, but the other big rock you mentioned was moisture. Is slugging different than that? Like, is there just a baseline moisturizer you're talking about? Does slugging do the same thing? And also, tell people what slugging is before we have this conversation, because that sounds alien like.
Yeah. So slugging is just a new term kind of that's been popularized to just refer to using an occlusive moisturizer. There's different ways you can moisturize your skin. There are humectants like hyaluronic acid, which kind of sponge up water and kind of hold water to your skin. There are emollients, which can soften your skin and make it feel more moist. And then there's occlusives, which form a barrier over the skin so that moisture can't get out. Occlusion is by far the most effective way to moisturize your skin. Most moisturizers are going to have some combination of these different methods, but occlusion is by far the most effective. It's going to have the most transformative results in your skin. It's going to repair your barrier function more, such that even the next morning when you wash off the occlusive moisturizer, your skin's still going to be more moist throughout the day because your barrier function has been repaired. And most people will slug either with Vaseline or with Aquaphor, which is another primarily Vaseline product, petrolatum product. But silicones can also be occlusive, and there's many other ingredients that are also occlusive, beeswax paste and things like there's a lot of ways you can occlude the skin. Hydrocolloid patches are also going to be occlusive. So slugging is just the use of an occlusive moisturizer, and we call it that because it looks like super greasy and sluggy, like you look
Yeah.
shiny, you look greasy when you do it. And so this is something that you mostly are going to be doing at night. For my business, I had a product called Slug Plus. Some
Mm.
people were just like, hey, if I want to, and I don't care if I look greasy, can I go out in the day with this? And it's like, yeah, sure. That's going to be great for your skin. I wouldn't do it because I have shame, but but you definitely can. And I've seen people just slugging up, and I've seen people that have been doing it for years, and their skin looks great. And I mean, they never look great because they're always greasy, but like their skin quality is good. But anyway, with the Slug Plus, I think I wanted to one make people excited about slugging. And one big thing that I wanted to do
Mm.
with my brand was there's all of these science-based companies that are coming out with these new novel technologies and then showing this new fancy research to show that they work,
Yeah.
which as we discussed can often be low quality and unconvincing. And there's all of these things like retinoids, like petrolatum, just Vaseline. So great for your skin. Like so much evidence for that, but it's just boring. And I wanted to make and not exciting, and like people don't look at a tub of Vaseline and think high-end skincare. This is something I'm doing for
That
personal
is
care. It's like
facts.
it's not yeah, they don't look at a tub of Vaseline and say that's self-care. You know what I mean? I'm pampering myself when I do that. And so I wanted to make a high-end product that people can slug with. Something that justified both a higher price point, like a premium price point, and made it worth it to pay that, right? So I included ingredients that changed the texture a little bit so that it felt less greasy. I included ingredients that helped it wash off in the morning a little bit better so that, it's
Mm.
easier to wash off. And I included other active ingredients because a skincare routine can get burdensome super fast if you're applying like
Yeah.
10-step Korean skincare routine. That's not me at all. I can't do that. So I want to include all of the active ingredients that I want in my skincare in the least amount of steps. And so some of the more lipophilic ingredients I added to Slug Plus. So there was a lipophilic vitamin C derivative called tetrahexyl decyl There are tyrosinase inhibitors. There's hexyl resorcinol, which is a tyrosinase inhibitor that's going to improve complexion. And then there are a lot of antioxidants that can help protect the skin from oxidative stress and also preserve the other ingredients in the formula. And a handful of other things there too that are just going to improve your skin quality, especially as it pertains to your complexion. And so adding that into a slugging product while still making it mostly petrolatum, still going to be super occlusive and not compromising on that was the idea behind Slug Plus.
That freaking sucks because it sounds like there's nothing quite like that. I mean, what your goal was almost what this did to me. I'm not saying like what you did with this,
Yeah.
but the goal of this is it made it more easy to use so people would
Yeah.
actually do it. Is this
Yeah.
something you still do like every single night? Is that one of your staple pieces of your routine? Is
Oh yeah.
slugging?
I still slug with Slug Plus every every night. Yeah. I still have some Slug Plus left for myself, but
Oh my gosh. Okay, I'm trying to picture because this is something that I am actually convinced. I've already told you that I'm trying. The video that I had found you on, I mean, it was like literally an entire case, maybe two of Vaseline on your face. How much are we talking about? Like, should I look like I'm dripping in petroleum jelly, like Diddy
No,
Party, or like,
no. I mean,
what are we doing? Especially because
it,
I'm a side sleeper, so I was like, is
mhm,
my pillow just going to be ridiculously slot? Like, how does that work? You know what I'm talking about?
yeah. So no, you don't. And in that video, I talk about it because I saw a few viral videos where people were slugging, and then I saw a bunch of dermatologists were like, "This is stupid. You don't have to do that. Like, this is a dumb idea." Because people were going viral just like doing that amount of Vaseline on the face. But because that was going viral, and capturing attention, I saw that as an opportunity to do that
Mm,
same thing to slug wrong and then take it back and say, this is not how you do it. This is how you actually slug. This is why you're supposed to slug. This is why it's a good idea. But first, to capture the attention by slugging like these viral creators were just by like glooping like a pound of Vaseline on my face, which was easy to do because
yeah.
I have a skincare company. So I had just buckets like 5-gallon pails of Vaseline for my skincare products. And so I had a ton to use for that purpose. Slug Plus hadn't been invented yet at that point, but that's one of the things that inspired me to start thinking more about what slugging options were on the market. Because after I made that video and viral, a lot of people were asking what to slug with, and of course the answer is Vaseline. But then I thought, what could I do to improve this? What could I, if I wanted to
Yeah.
design the best possible product for slugging specifically, what would that look like? And that was the conception behind Slug Plus.
The conceptual moment. I do want to ask about the business side of things, right? Like, what was the genesis of it? What ended up closing it? What would you say to people that want to use something like that now that don't want to use Vaseline? Like, is there something comparable out there that is similar to what you had?
No, not really. And that's the bummer. So I think your best option is going to be your Vaseline or your Aquaphor. There are other slugging products, but they tend to be oil in water emulsions, so they're like slightly more occlusive than something like a normal moisturizer, but they are not the concept where it's like this is basically Vaseline plus some good active ingredients, especially not the active ingredients that I was using that are going to be like meaningfully make a
Yeah.
difference in your skin. And so there isn't really a product like that on the market, which makes me really sad. And that was my whole like if there was a product on the market, I would never make a product. Like I would just buy that product. Most of the time I'm making new skincare
Yeah.
products for myself because there's an unmet need. I'm like, I want this thing. I look for it. I'll spend a whole day looking at all the different skincare products and they'll be like, damn, there's no one's made this thing yet. And so then I'll make it for myself. And that's how most of my products start. So if there were a product like that in existence, I wouldn't have bothered spending a year developing it?
I love that. But before we get into your skincare line, when it comes to the slugging piece of it, just because I know this took my brain like probably a good couple months to actually wrap around because it does seem so counterintuitive. How, why, I don't even know where to start. Why does it not cause breakouts? And how is it
Yeah.
actually benefiting the barrier? Like if someone uses it regularly, is it mainly just for the extra hydration? Is it
Mhm.
preventing water loss? Or are there other benefits that come to it, like calming irritation or letting the skin heal? Or if you have acne prone skin, like is this still something you do? Because it seems
Mhm.
jarring that you would just clog your face up with it,
Yeah.
you know?
So, like I said, the clogs aren't really caused by things on the surface of your skin. They can be if the things on your surface of the skin are causing inflammation, right? That can influence
Mhm.
the acne process. But I think the idea that like you just put some gloop on your skin, you put some oil on your skin, and like that oil that's sitting on your skin clogs the pore is not true, right? The pore is just going to keep coming out. Like you're not going to plug it with something like that. In fact, there was a study in a dermatology clinic where they looked at people who were suffering from acne patients, and they gave them some of them petrolatum and found that there was a decrease in acne in the people who had received
Really?
petrolatum. Yeah. So, and it wasn't huge. It's not like this is a cure for acne, but
Yeah.
there was a statistically significant difference where people who were given petrolatum who had acne had less acne for using it. And it just comes back to the misconception that acne is caused by dirty or oily skin, or that it's caused by things you put on the surface of your skin that clog pores, which is it isn't. The pores clog, but for a different reason. So yeah, it doesn't cause acne, and it's perfectly safe for use in acne prone skin.
I like to, at least when I go to content, one of my strategies is to go to the extremes to prove to people like, where do we have a common ground? Where can we meet? If you
Yeah,
want to change someone's mind, I think that's a helpful strategy. Like, let's go to an extreme that we can both agree on and kind of take steps back from there. I'm like, if you still believe that that's what causes acne, I feel like that should be the only thing you need to see to
yeah,
reframe how you see
yeah,
acne. That's too funny to me. Okay, but
absolutely.
now I'm curious about Eviba skincare.
Hmm.
And I want to start by talking about the genesis of it. Because this is something that in your content I've seen, I mean, you've had content for so long ago that you would talk
Yeah,
about it. And then I know, like weeks or even months ago when I tried to go look for it, I think it was actually your Slugging product. I couldn't find it anywhere. I'm like, I must be wrong, or you are the worst person at like funneling people to where you're selling things because I could not
No,
find
no.
it anywhere. So let's talk about the genesis of it. Cause I was telling you, I really admire the fact that it is created to solve a problem that exists. It's not meant to just sell or fill a line. I think I was comparing it to how I see like Derek from More Plates, More Dates and his gorilla supplement mind. Like so many supplement companies just literally do it because it makes money. It works. Like they'll come up with the
Yeah,
same products, change absolutely nothing, but just know how to market it because they know it makes money. Where a few different brands, and it seems what you do, it's like you really don't create something unless you're like, this needs to exist. Why does it not exist? It's going to make a meaningful impact. So take me back, genesis of Eviba skincare.
yep.
How long ago was this? What was the breaking point to make you do it?
So I started Aviba in 2017, and it was originally quite small. So I made products for myself. I started with a hair growth serum actually, but I just started making products for myself, and people started noticing that my hair and skin were just looking incredible and wanted to get on it. And so I started selling it to a list of private clients. I started formulating products for myself. I made some bespoke products for others, and I just started getting a reputation and just having this small client base that bought my products. And so I was doing this for a very long time. And then as it grew, one of my childhood friends got involved and sort of came back in my life and wanted
Mhm.
to help me grow it. And he had this pedigree in marketing. And he convinced me to get into like a 50-50 contract with him where he owned 50% of the business. Like I've been doing this for a long time, right? And he just comes in and gets 50%. It seemed
Yeah.
like a good deal because he was talking a really big game about all the ways that he was.
Especially when you're the expert on that side of things,
Yeah,
like business
yeah,
is a skill. So if you're the other
yeah,
side, you're like, man, if I just could have this piece, it would just
yeah.
take off. Is that kind of where you were thinking of it?
Yeah, and also, like, I was in medical school at the time. I wasn't able to run an entire business by myself, so he was coming in as COO to help me run this business. He had all of this business, or at least it seemed that he had business and marketing experience that was going to be helpful. But then after the contract was signed, he just really wasn't carrying his weight. He was causing just so many problems, both in the business and, like, just weird problems in my personal life. He was just always steering the business off course and making things so much more difficult than it otherwise would have been, and I was just always having to just fight so hard to get anything done or have this business make money, and I had to accept that, like, it just couldn't continue, it was just it was a nightmare. It was really one of the worst things that has ever happened to me, just watching my entire life's work just kinda slow to a crawl and just be constantly tarnished by someone who just clearly didn't care at all, or just didn't have the skills or respect to help me with this business. And it was really sad because, I spent my life doing this.
Did that cause you to hold on longer than you think you probably should looking back at it, like hindsight? I mean, because I'm imagining, I mean, when you
Yeah.
make something like that and it really does, like you put in
Yeah.
every ounce, especially when it's like something that you truly believe in, right? Like it's
Yeah.
not just a business to make money. Like when it's something that
Yeah.
you're like, holy crap,
Exactly.
I
It's my passion.
created this. This
Yeah.
wasn't here. I willed it into existence. Like there's so much that goes into it that people say it's like your child. And I
Yep.
truly believe that, right? That's how I feel about what I've done. Probably how you feel about a lot of things you've done too.
Yeah.
Did that cause you to hold on longer than you think you should have? Like hindsight,
Absolutely.
would you have changed getting out of it? You're like, it just was like a sunk cost fallacy, or
Yeah.
how did that go?
Exactly. I held on way longer than I should have and gave him way too many chances because, like, I knew that stopping would mean that the business was over. The business was gonna die. Everything I worked for was gonna disappear.
Yeah.
But eventually I just have to accept that the business is gonna die either way, and you have to cut your losses at some point. And it sucks because so many people love my products. People are still emailing me, like, on a nearly daily basis asking when the products are gonna be back,
Yeah.
and so forth, but I just can't. And also just, like, I didn't wanna build a company like that. There were a lot of very concerning behavioral things where it's like, I want my employees and my company in the future to feel safe, and I just didn't think that they would in that kind of culture, and I didn't wanna subject people to that? And so I don't know exactly what my future is gonna look like, but I'm completely heartbroken by this. It was everything to me, this business, and now it can't continue, and I have to find something else to do, and I'm sure it'll work out. But one of the hardest things I've ever been through.
Yeah, it absolutely will, but that's not something you just get over usually because
Yeah,
it was, I mean, that was 8 years ago. When did it finally come to, like, when did you make the decision to close it down?
it's about less than a year ago is when I made the final decision to close it down. Yeah,
Oh, wow. Okay, so still fair, like, actually really recent
yeah,
in terms
yeah.
of, like, the life of the business. I'm curious, because you put so much into it. I am curious on some gemstones found in there, like, running a skincare company had to have been an insanely big learning experience from the start, right? Like, just
Yeah.
learning how to operate and do that things. How far did you take it at its peak? And I'm just even curious of, like, a few milestones or successes that you're the most proud of when you were doing it. If it was a product that did really well or just something that you had conceptualized for so long that once you got to see it in real life, you're like, "Holy crap." Like, it could have not sold a single bottle or product, but just, like, the conception of, like, it is real now. Was that a big milestone? Like, what were some of the bigger milestones that you had hit?
I mean, I just think anytime I have an idea and it comes to reality, it just fills me with so much joy. And then the customer feedback was my favorite thing. So many people reached out and showed me pictures and just like before and afters. I don't think like in skincare, I think in general, before and afters are kind of a weak way to show your product works. Like there's so many
Mhm.
like lighting conditions matter so much or whatever. But people would send me pictures and just say how much my products had changed their life and how no other skincare had worked. And those were the moments that really inspired me to continue was knowing that I had helped someone's skin, especially because it was kind of a risky approach, right? I wasn't following trends. I wasn't doing the things that most skincare companies
Yeah.
do to try to get customers. Like with the tyrosinase inhibitors in the slugging product, it's like I didn't really market that, you know? It's just something that when people
Mm.
started using it, because people don't know what these tyrosinase inhibitors are. So it's just something that when they start using it, they know their skin looks better. And that's kind of a risk that I took, and when people actually notice that effect that I intended to have on their skin and are grateful for it and became long-term customers, that was the happiest thing.
That is interesting because it kind of feeds this loop where, even if no one had used it, you're pretty confident in, like, what the product is and what it can do.
Yeah.
But I just feel like, I don't know, sometimes your brain, it needs to see something visually, like, when you get that external feedback of, like, "Oh, other people see this too, it's not just in my head," especially for something that had been in your head for probably years
Yeah.
to come. It's like a drug, the feeling you get from it. I don't know if it's a being seen, if it's anything like that. Okay, so conceptualizing a product and just getting it real, were there any big milestones you hit that you were, like, proud of?
I would go to the local post office here and, like, the ladies that work there would celebrate my wins with me, you know? They would see me come in with a ton of packages, and they knew what I was doing, and they were so happy for it.
Yeah.
So, like, because they saw me first coming in, 1 package, 2 packages, every day, and then I'd come in with, like, 2 or 300 packages, and they'd be happy for me, even though that's a lot of work for them, and so those were moments that I
Yeah.
cherished.
I'm almost melting thinking of, like, a USPS store like that, just seeing because it really was like a ground up. It's not like you figured out a loophole where you could drop ship or do something like that. It's like
Yeah,
it started with 0. Like, we started at 0 to 1 to 100. That is adorable.
yeah.
So even looking back, there's a lot of skills you probably gained from that.
Mhm.
And even though I know it's still, I mean, a year is still fresh. So correct me if I'm wrong. I'm like, I doubt you have this now clear path of, I know exactly what I'm going to do. I'm going to start a new business. I'm going to do this because I know you're doing a lot of different things too. You're the chief product officer at HelloSkin. You're doing a lot of different things. I'm sure it's not clear, but going forward, are there now things that you know from that experience that you're like, okay, I've got pieces. I just got to figure out how to put them together now?
Yeah, anytime you do anything, you gain a lot of skills that are gonna be transferable. I think the biggest lesson I learned was choosing who I work with better because I
Yeah.
think that that was really the biggest issue was all of the other parts of the business, I found it pretty easy to figure out. It's not like I
Hmm.
started in this business and I knew everything about marketing or about whatever, but I learned all of these things on the way and I had a good time doing it. But I really realized that my biggest mistake was going into this contract and doing a deal with someone who I thought I trusted, but really didn't vet out properly, didn't listen to some people who told me that it was probably a bad association, didn't trust my gut feeling. Cause I think there were red flags in the beginning. And,
Yeah.
but now, especially as I've grown as an influencer, I have met so many other people who really I can see have a much better attitude, or are
Yeah.
much more helpful and excited to work with me and have good ideas and just I can form productive relationships with. So that was the biggest thing that I learned. And I think my tendency is just to really trust everyone, especially friends and stuff. Like I I think tend to always want to be helpful for people and like get everyone excited to work together and find win-wins where everyone benefits. And because I'm that way, I think I just assume everyone else is that way. And I think people in
Yeah.
the past have taken advantage of me because of that. And now I'm just learning to see the signs and trust my gut instinct a little bit more and be more selective. And it's hard for me because, I see everyone as a potential friend and try to see what their skills and things they can, you know, do are and find their assets, right? But I think that I'm learning that not every relationship is a good one.
But I also don't think there's a flaw in that because I'm gonna be honest, like, I feel like we are very similar in that way. I'm an extremely trusting person when it comes to people, like, I kinda gone through that because I know a lot of people are afraid to trust. Like, I've been in relationships that were just very anti-trust to start, where I'm more
Yeah,
like, "I'm gonna trust you until I have a reason not to trust you," right? Like, why would I not give you the
right.
benefit of the doubt?
Yeah,
Like, I think it should be a race to second place, right? Like, you're putting the other person first
same, yeah.
until things change. And I still think even though you can get taken advantage, and I think that's why people get scarred and put their walls up is especially when it's something like that. Like this is not talking like someone lied to you or said, "Hey, let's meet for lunch at 12," and they didn't show up. Like that's a life-changing event that goes through with it. I still think you will net outcome in the end turn out better in believing in people than distrusting people.
Yep,
Like you will get taken advantage of a time or two, but I think there's going to be 100 more times where that doesn't happen, that the
yep,
benefit you get from trusting others first will be so much more massive long term. It just sucks
yeah,
that it has to happen sometimes because there are people that will take advantage of it, and it's hard to move forward past that and keep that same attitude,
yeah,
especially when it's something so close to your heart. So
yeah,
I would even say, like, hindsight, it probably makes sense. You're like, yeah, there was red flags, but also that was 8 years ago. I don't think you could have. It doesn't
yeah,
seem like you were being naive.
yeah,
There was excitement involved. There was a million different moving
yep,
parts. Because I
yep,
know hindsight, it's really easy to be like, I'm an idiot. I should have seen this
yeah,
coming. But it's like,
yeah,
sometimes it's not as easy in the moment.
yeah,
But okay, it's interesting that it started with you said a hair serum. So that's what kicked it off. Like, because I know there's a breaking point for like, okay, I just need to do this my own. Like, something doesn't
yeah.
exist. I need to be the one that freaking makes it. Hair serum seems different than what you do today by a few yards off. What
Yeah.
started that?
So with the hair serum, my girlfriend at the time, she was complaining that I was balding. She said she could see my scalp a little bit. And I don't want to go bald either because I have a big scar on my head from a surgery I had for an epidural hematoma. And so I just started reading research on hair loss. And what I found was that there was no product in the market that really targeted all of the mechanisms I wanted to hit in a formulation that would have been cosmetically elegant and look good in the hair.
Mm,
And so I had to make my own, and when I did, my hair just flourished, and everyone around me noticed and wanted to get onto that formula that I was using. They had no idea that I made it myself or anything. And so that was the impetus for this. And later on, I got into skincare because that's just easier to market because hair loss is a disease. But really following the same approach of just including things that have good evidence. Like there's so many things in the market for hair loss where it's like they have some very poor quality science and I think
mhm,
it's really unfortunate because a lot of people will use these products. They'll be convinced by the marketing, convinced by what they call science, and they will use these topical products for a couple years and it might look a little bit better at first, but their hair starts falling out and then they stop using it. More of it falls out and they're like, oh, all this whole thing is a scam. Hair loss, it doesn't
mhm.
work. But it's sad because there are effective treatments. And if you just read the research with a critical eye and use the things that have been shown repeatedly in high quality research to work, you can pretty much completely prevent hair loss in most people.
Is it when people started to notice where you're like, "Wait a second, I should make this a company, like, I should incorporate this instead of just make this on the side for myself?" Is that what the
I
first
mean, it
domino
just
was?
started, yeah, with me making it for my friends, but then it later on became bigger as I became more well known for the products that I was making. It wasn't just hair loss, but also skincare products as well. That's how it started.
Okay. Hair and skin, it's interesting because a lot of I feel like sales and marketing is driven towards insecurity. And I do feel like skin, and I would almost argue hair, probably more in guys than girls, is such a core part of someone's appearance from like your perspective, why hair loss is so psychological. I don't quite know or why it's so impactful and people care about it. It's not like it's everything. Like there's a lot of
Yeah,
people
yeah,
who don't care for it, whatever. But I do feel like it is such a big part of someone's appearance. And I feel like that is why it's easy to market and target like crappy products that probably exist. I'm curious in seeing any similarities in the skin care world that you've noticed? I personally was telling you, I use minoxidil and I microneedle up here just because
Mhm.
hair loss. I have a hilarious picture. I don't like to share like personal photos on social media with a decent amount of following,
Yeah.
but I have 4 uncles all on my dad's side,
Uh-huh.
and there's a picture of them all at like 28 years old, just completely bald. And I
Yeah.
was terrified of that since I was a kid. And at least from my understanding, hair loss prevention is so much easier and more effective than regaining something that's lost. Not that it's entirely impossible, but magnitudes easier to do.
Mhm.
From what's out there, I feel like minoxidil and finasteride are like the basics, the 2 FDA approved pillars for hair loss or pattern baldness. Minoxidil and like Rogaine, I believe, and finasteride usually taken orally. Can you explain how those work a little bit? If it's male versus female, or if it's different at all for just
Mhm.
growing hair? Is it something for hair health? Especially the difference there. Is there a
Mhm.
difference between just overall general hair health and regrowth with these 2 treatments?
So, I think hair loss in women, I think, is undertreated. Women experience androgenetic alopecia at lower but comparable rates to men. So,
Hmm,
and nearly all men are going to experience some amount of androgenetic alopecia, right? Hair loss caused by androgen exposure, testosterone, DHT, throughout their life. No one is going to have the same hair naturally at 60 that they did at 20.
mm,
And finasteride is generally prescribed to men. And I think that in general, the core hair loss routine should include at least one anti-androgen, typically finasteride, but dutasteride is another one. There are some other, you can use it topically, topical finasteride. There's clascoterone, which is a new androgen receptor blocker, which I think is going to be less effective, but I think finasteride, dutasteride, one of those essential. Beyond that, there's other hair growth stimulants that you can use. Minoxidil is one of them. Minoxidil Rogaine works in men and women. There's a sort of pink tax 2% minoxidil version that's marketed to women, but it's generally safe and more effective for women to use the 5% version. So they should
yeah.
also use the 5% men's version of minoxidil. And
Oh, that's
microneedling,
oh,
as you said, is another thing that I think is very underrated, and I think more people should do microneedling at home for their hair loss than what they're currently doing.
that's one thing that I do wanna ask you more about because I'm less familiar with why it works. I know it works ridiculously well,
Yeah.
especially when you pair it with different things like this. I'm curious on the finasteride or the androgen blocker for women, because
Mhm.
I've never explored that idea before or
Yeah.
even heard it. I just feel like it's
Yeah.
been marketed to
Yeah.
men. And did you
Absolutely.
say too, it was more for hair health in general, not even just for someone trying to regrow? Did I hear that right?
Hair maintenance, yeah. And so, like, when
Mm,
you block androgen exposure, you're going to have thicker, healthier hair. So, using anti-androgens isn't just going to prevent hair loss, it's also going to stimulate hair growth. Your anagen phase of your hair, which is when it's growing, is going to lengthen so that your hair can become longer. The shaft is going to be thicker on each hair. Finasteride, I think, is underutilized in women. There are studies showing efficacy in women, but the concern is with birth defects. So, a woman who gets
mm,
pregnant is going to be using this anti-androgen and could potentially have a feminized fetus because the fetus doesn't get androgen exposure. But it's the same thing for spironolactone, which is commonly prescribed to women for androgen receptor blocker and less effective, but also a DHT 5-alpha reductase inhibitor. And so I think women can benefit from finasteride as well, and a lot more women should be on it, using birth control at the same time and taking other measures to prevent pregnancy. But same thing with spironolactone that's commonly prescribed to women. I think underrated for women, but definitely minoxidil, I think a lot of women can benefit from.
okay, so both men and women. Now, we were talking about this the other day because I'd brought it up to you, and once I had heard that your first Eviba line was a hair serum, I know finasteride just being an androgen blocker, a lot of dudes like, there's insecurities that get picked on for men and women in
Yeah.
both industries
Yeah.
that get marketed and exploited. I feel like for dudes, anything that is branded around testosterone is 10 times more powerful, right? Every dude just wants more testosterone.
Yeah.
So when you hear finasteride basically blocks DHT,
Yeah.
is the goal of it, is to block the conversion to DHT, which is somewhat of like what, 7 to 10 times more androgenic than testosterone itself. Male brains are like, I'm going to lose all my muscle. I'm
Yeah.
going to turn into a girl. I'm going to sprout little boobies. But the way you're explaining to me, it basically took any fear away of doing it. So can you explain like why is that not seemingly as big of an issue as people think it is?
Yeah. So in general, I think the biggest concern people have with finasteride is that it's going to cause erectile dysfunction. And in general, feminization, like gynecomastia, growing
Yeah.
boobs, like that's also something people are concerned about. But I think that there's a lot of fear mongering out there. And when we look at studies, a lot of them show little to no difference between placebo and control with finasteride when it comes to erectile dysfunction. But that doesn't
Mm.
mean no one's getting erectile dysfunction. I think what's happening is that hair loss and ED are sort of related conditions. They both have a vascular component where you are losing blood supply to the hair follicle, you're losing blood supply to the penis, and these things kind of tend to happen around the same time. So when your
Yeah.
hair loss gets so bad that you're about to go to a doctor and actually get something prescribed and then start taking it, chances are for a lot of men, ED is just around the corner for you. And, just being in
Mm.
family medicine rotation or whatever, like tons of men, 30s, 40s, they're coming in with ED concerns. They never use finasteride. It's just a common thing that happens at
Yeah, just that time.
that point in your life when you tend to start getting on these drugs. So none of there is absolutely zero effect, but I think that it's a lot safer and a lot less likely to cause these issues than a lot of people think, especially with post-finasteride syndrome. I think what's happening is post-finasteride syndrome is when people take finasteride, they experience ED, they stop taking finasteride, and then they, never get the function back again.
Yeah.
And they say that finasteride permanently ruined their ability to get an erection. And this doesn't make sense just from like a pharmacological perspective, right? The drug is way out of your system. Nothing was damaged, presumably. But I
Yeah.
think what's happening is that they just happened to take finasteride, and then a month later or whatever it was, they started getting the first symptoms of ED, which was just part of their life path, regardless. And it never came back because it never really was the finasteride that was causing it. So that's how I feel about this issue. I've been taking finasteride a very long time and never had any issues like that. And I've also never spoken to someone in person. I see online people talk about it all the time that has
Mhm.
had serious issues with finasteride. So I think it's a lot safer than most people think. And just to go into more detail about that, with DHT, your body in most of the tissues in your body creates an enzyme called 3 alpha hydroxysteroid reductase, which breaks up DHT like pretty immediately once it gets to the tissue. So this is why you don't see like muscle wasting with finasteride. So you would expect you take
Yeah.
finasteride, you stop producing DHT, so like that DHT now can't just like grow your muscles. You'd expect your muscles to get smaller, but they don't. And the reason is because that DHT exposure was never causing your muscles to grow because your muscles were just breaking up that DHT immediately as soon as it gets to the tissue. And this is the case in your brain. This is the case in most of the tissues in your body. DHT is just broken up immediately. There are some exceptions, being the skin, the prostate, whatever,
Mhm.
where you can have DHT accumulate and stimulate the AR in a meaningful way. But for the most, and that's, but for the most part, like this hormone isn't doing anything because we have this mechanism that breaks it up pretty rapidly, and that's the concept between DHT derived steroids like Anavar and some others, where these steroids were modified in a way so this enzyme couldn't break them up. So now it's DHT that can't be broken up,
Mm.
and it can really stimulate the androgen receptor in the muscles and cause some muscle hypertrophy. But DHT
Interesting.
itself is susceptible. It breaks up and it doesn't cause any problems. So that's why finasteride is such a safe drug, is because this hormone is being broken up and doesn't really have a chance to affect our tissues either way. So removing it doesn't matter so much in most cases.
So it seems like a lot of the fear even just stems from a simple misunderstanding of like how important DHT is. Cause I think at least when I was younger and heard about it, when you hear it, like somewhere from 7 to 10 times more androgenic than testosterone
Yep.
itself, you
Mhm.
hear that and you're like,
Yeah.
wow, I've been taught my whole life testosterone
Yeah.
is this like panacea, this
Yeah.
golden key. And this is 7 times, you know what I'm talking about? Like you just paint this massive picture of it when in reality it seems like it's so small of a player. And I feel like, would you even say if people were still afraid to take that step, is something like topical finasteride that would only be absorbed in the scalp something
Mhm.
that would forego any worries that would be there?
Absolutely. So it really depends on the concentration because you can apply so much finasteride to your scalp that systemic exposure and systemic DHT reduction is similar. But at a lower concentration, you
Mm.
can have lower systemic exposure while still treating the scalp with topical finasteride. And that's what I recommend for most men is topical finasteride, especially because I think you want to have a full routine that includes not just finasteride, but also minoxidil, also other hair growth stimulants. So if you have to apply those things to your scalp every day anyway, might as well put the
Mm.
finasteride in there. It works just as well as orally. And so I think it's a great thing.
For women too, or just for men for the topical?
For women too, again,
Okay.
It's not commonly prescribed for women. I think that that's a mistake. I think that over time, I'd hope to see that change where we take women's hair loss more seriously and we, with the proper precautions, prescribe things like finasteride to women who are losing their hair as they age. But right now, it could be difficult to get a doctor to prescribe that.
This almost segues just like the skin health conversation did a little bit too. Not everyone is dealing with balding, right? Like not everyone's
Yep.
dealing with acne at the time, but a lot of people do want just thicker, healthier hair strands
Yep.
too. How different is the approach to improving hair quality? So maybe like the shine, the thickness of each strand, reducing breakage or shedding versus treating hair loss where follicles they're dying off. What are the differences and similarities there?
I think those two things are related. One, I think people need to appreciate that most men, these follicles are miniaturizing and they won't come back. And the longer you wait, the worse your long term progression is going to be.
Mm,
So I think most men should assume that they are losing hair at some rate and
mm,
treat that sooner rather than later. But in general, I think it doesn't hurt to if you just want thicker. You have a full thick head of hair, you want it to be a little thicker. I think that the core hair loss routine should contain an anti-androgen. If you're only if you really don't want to accept that you're gonna lose hair and you
mm.
just want thicker hair, you can definitely apply minoxidil. That's gonna make it thicker and make it look healthier for the most part. Some people find it irritating to the scalp. There's different formulations, but yeah, for the most part, you can get thicker shafts, healthier hair, and then I think just hair care in general. There's so much to go into the topic of like how you can make your hair look better, hair care wise, but you don't want to be doing things that damage your hair.
That is interesting. I never thought about that. Not causing hair damage, just like how protecting yourself from sun damage is the most effective thing you can do for your skin. Is there something like that when it comes to your hair? Like something that if you could avoid this, it would just have such a disproportionately large impact on your hair health?
Not in the same way, especially for men with shorter hair where you have less time for it to damage. So, like, if you have
Mhm,
longer or if you're a longer haired man even, like, if you have hair that's very long, it's like, 5, 6 years old, this hair towards the bottom, like, it's been
mm,
around a long time. It's been exposed to UV. It's been exposed to heat from the dryers or crimpers that you use. It's been go through many wet, dry cycles that can damage the hair. It's been exposed to a lot of surfactants and things in the shampoos. That's when you gotta worry more about those things. But for men with shorter hair, it's a little bit less of a concern. But you definitely don't wanna do things that would explicitly damage it, like dyeing it frequently can cause problems.
I did that once.
Yeah, I dyed my hair once and it didn't look good.
Okay, so outside of a minoxidil, an androgen blocker like a finasteride, are there any other staples that if you want thicker, healthier hair, is it a certain maybe thing that you would do in how you wash it, condition it? Is it a product that you'd apply after the shot? Like, are there any things that you would consider staples without having to open that entire can of
Yeah,
worms?
there's so many things that you can do to promote hair growth. I think the big 3, your finasteride, minoxidil, microneedling. I think that covers
Mhm,
most of your bases. Beyond that, there are other things you can do. Some of them are more specific. So if you have dandruff, if you have seborrheic dermatitis, then you
mhm,
wanna be treating your scalp with ketoconazole, and that's going to reduce inflammation and prevent hair loss from the inflammation caused by the Malassezia fungus that's causing this condition. There are a lot of things like that as well. There's a lot of other hair growth stimulants that you can apply that have more or less evidence. I think that not being protein deficient is big, having a good diet
mhm.
is big, sleeping well. And this goes into the difference between something like finasteride. And one thing I think about is like in rheumatoid arthritis, we have this term called DMARD, which means disease modifying rheumatic drug.
Your memory is outstanding today on some of these words.
Disease modifying anti-rheumatic drug. Rheumatoid arthritis is when your immune system starts creating inflammation in your joints, which causes your joints pain. We have two types of drugs that can treat this. One is if you have pain in your joints, you can just take ibuprofen, you can take Tylenol, and these will reduce the pain, but they're not going to affect the disease progression, the damage to your joints that's caused by this inflammation. This inflammation is going to cause damage to your cartilage, damage to your tendons, damage to the bone in the surrounding areas. And over time, this is just going to progress and become worse and worse and worse. So there are drugs that are going to treat the pain. And then there's drugs called DMARDs, disease modifying anti rheumatic drugs, which are going to change the progression. They're going to stop this inflammatory response. So you have methotrexate, you have some biologic drugs. And I think we really need to start thinking about hair loss in this way also. So, like disease modifying anti alopecia drugs, right? Ones that are going to change the course of the miniaturization of these follicles versus ones that are just kind of hair growth stimulants that are going to make your hair look better, grow better, prevent
Mm.
shedding, things like that. And so I think finasteride, and it's not always clear because we don't tend to categorize it in this way as we do with anti-rheumatic drugs, but I think we should. I think we should think of finasteride as being a core DMAD, right? Where this
Oh.
is going to change the progression of hair loss. And then something like minoxidil, it's a little bit less clear. There are some long-term studies, but generally it doesn't look as good. So I think that's kind of the border. But I think a lot of things are just hair growth stimulants, that
Mm.
aren't going to change the progression of the disease at all, but can improve hair growth. So a lot of antioxidants you might apply to the skin, dietary changes, things like that. A lot of these things, they aren't going to stop the progression of hair loss, but they can make your hair stop falling out, right? Because there's the progression of the disease, and then there is telogen effluvium, where the hairs just kind of all fall out at once. So if you get sick, if you get a virus, your hair can
Mm.
fall out. And that doesn't worsen hair loss, right? Your hair can actually look thinner. It can become thinner, but that hair is just going to grow
Yeah.
back in the next cycle. And so there's a lot of things that can lengthen the cycle, that can prevent shedding, but aren't necessarily going to change the course of the disease. And I think that we need to make a distinction there and always include things that we know are going to change the course of the disease, especially finasteride. And then on top of that, we can add these other things that are going to acutely make the hair look better, hair growth stimulants. And that's kind of how I think about hair loss. So there are a ton of different things you can do to prevent shedding and give you thicker hair, but this should be on the base of a disease modifying drug.
Are you familiar with anything else that's being worked on other than like a finasteride that does that for hair, that changes that cycle that is being actively worked on, or not really? You just think that's a huge area of opportunity that should be poured more into?
Yeah, I think there are a lot of other anti-androgens that hypothetically will be disease modifying in this way. So dutasteride the big one. There is less evidence, but the evidence that we do have for dutasteride is a lot stronger. Dutasteride is going to block all three isoforms of 5-alpha reductase, and instead of a 70% reduction in the scalp of DHT, you get about a 90% reduction of DHT in the
Oh,
scalp.
wow.
So dutasteride is very promising. I use finasteride myself just because I prefer things that have a long history of use,
Mm.
and like there's 10-year studies on finasteride, and we just know how well it works. And with dutasteride, we have a lot of good evidence, but I'm not fully there. But I don't discount anyone who wants to use dutasteride instead and thinks it's better. I think it likely is. And so we have that. We also have androgen receptor blockers. Spironolactone is one of them that is generally prescribed to women for acne, but there are some studies with topical spironolactone for men. There's also clascoterone, which is now FDA approved for acne as Winlevi, which is a androgen receptor blocker. And by that I mean you have testosterone, it converts to DHT. That DHT is now, like you said, 7 to 10 times more potent at stimulating the androgen receptor. And you can block this conversion of testosterone to DHT so that you get a lot less androgenic signaling through the androgen receptor, because now you have testosterone, which is a much less potent stimulator of the androgen receptor. And that's great. And that helps a lot. I mean, long term results are really great, but we end up damming up this process where testosterone is metabolized, and we actually have higher amounts of testosterone in the scalp after we start using DHT blocker. And so I think there could be some benefit in also including an androgen receptor blocker to block that
Mm.
testosterone that's left over, block the DHT that's still produced because it's not ever 100%. And I
Mm.
think that in some cases, it might make sense to use an androgen receptor blocker on its own, especially for people who are concerned about finasteride or dutasteride side effects. But overall, I think it's a much better bet. These things haven't been shown to have super great efficacy, and I think it's because it's much harder to compete with DHT for binding than it is for testosterone. But I think when you do block some of that conversion, it can be helpful to add an androgen receptor blocker.
Interesting. I want to touch on that third rock that you had mentioned, because this is something that when I actually started looking at the research, that's what pushed me to look into microneedling, at least for regrowth. Because
Yeah.
I've actually seen significant regrowth, not just thickening, but like there was no hair there and now there is, because I was losing it right here. And I actually saw significant benefits from that. If someone's not losing hair, and this is something that I literally only do like very uh, specifically located where I noticed hair loss. Is this something you do to your whole scalp? How are the different methods that you do it? Because I know I use a pen that goes in and out. I know there are derma rollers that you roll on that aren't electronic
Yeah.
that I've heard can damage the skin just at the angles that it goes in at. I don't know
Yeah.
if that's completely factual, but
Yeah.
how would someone incorporate that third big rock on top of those two into their routine?
I like electronic pens, devices. I like the Derminator. I think that's the best device in the market for home use now. Derminator 2, that's what I use on my scalp
I
personally.
like that name, the
Yeah,
Terminator.
Derminator 2. You wanna use it over the whole scalp, right? The
Really?
hair
Okay.
yeah, so if you're just doing it on where you're already having hair loss, the areas surrounding that are the areas where you're gonna have hair loss in the future and you wanna prevent it. So you definitely wanna do the whole scalp when you microneedle, when you apply your topical finasteride, topical minoxidil, should definitely be the whole scalp, not just on the areas where you are losing hair.
And this is men and women you said would benefit from this.
Yeah, men and
Wait,
women would both
okay.
benefit from microneedling minoxidil, and I think in a perfect world would also benefit from finasteride, like I said, not commonly prescribed.
Now, can you just briefly, what does it do? For those that are unfamiliar with this concept, what is it briefly and why is it effective? Like, what does it do? Because that's actually confused me too. I've heard collagen, stimulus, I've heard a lot of different things, but why is microneedling so effective?
There's a few things that go on with microneedling. So one, you're just causing little micro trauma to the skin. So you're puncturing the skin, and that causes like a wound repair response where you start producing a lot of growth factors and things, including vascular endothelial growth factor. It's going to help produce little vessels that are going to be able to give blood supply to the skin, so it improves blood supply to the skin, and a lot of other growth factors that are going to just stimulate the hair follicle to produce more hair. But I think one thing that's underappreciated about microneedling in general for hair loss is one, when you go to like a clinic that does microneedling, a lot of times they
Mhm.
almost sell it to you as if the purpose of microneedling is to improve absorption of other agents. So they're like, oh, we're
Yeah,
going to
I've heard
microneedle
that.
in so that the exosomes go in, microneedle so the PRP goes in, right? And things like that. But microneedling itself is very underappreciated and you don't need all of the other things. So microneedling will improve the absorption of your other things, may improve the absorption of your minoxidil, may improve the absorption of your finasteride. But if you're using these things at the right concentration, they should be working anyway. They don't need microneedling to get in there. And the benefit of just having better penetration for a day or so every once in a while,
Mm,
I think is like super beneficial. So it's the combination of one, like all of the wound repair pathways that are being activated when you create these micro traumas. And this is just hypothetical, but from what I see with hair loss and how much hair regrowth I see with microneedling compared to
mhm.
other therapies, I think what could be going on is that part of the hair loss pathology is that you are creating scar tissue around the follicle called perifollicular fibrosis. And this is ultimately one of the things, the hair loss pathology is like multifaceted, but this is one thing that contributes to permanent miniaturization of the follicle is that you start developing the scar tissue around the follicle. And that constricts the follicle, prevents it from being able to produce as many hairs, smaller hairs, eventually just a little vellus hair.
Hmm.
And the follicle is just a remnant of itself. It's basically dead at some point and it won't come back. And I think what microneedling is doing is, and this is hypothetical, but I think it may be breaking up some of the scar tissue. I think that no other
Mm,
therapy can break up scar tissue. You're not going to break up scar tissue by applying a cream to your head, by taking a pill. Microneedling
yeah,
was originally developed as a scar revision treatment where a doctor was trying to tattoo scars, like raised scars that were discolored, skin color, right? Just
really?
with skin color ink. And that didn't work that well. The ink, like tattooing skin color ink, just looked kind of weird and not a great result. But what he discovered was that these scars started going away. Like they were less raised, the scar tissue was breaking up and being replaced by
Interesting.
healthier collagen networks. So I think that's kind of what's going on. What could be going on here is that the microneedling is breaking up some of the scar tissue around the follicle and reversing the miniaturization a little bit. And I think that it's unique in that because no other therapy is going to do that.
True. I've never thought about it like that, but that is an interesting take. Okay, so those are your big 3, because I'm even thinking back now, the research that I had read was always comparing, like, Minoxidil on its own versus with once a week
Yeah. Yeah.
microneedling. Now I'm trying to
Yeah.
remember back if any of them actually just did it next to just microneedling and
Yeah.
nothing topical on top of that,
Yeah.
and what the difference would have been, because it's that
There
same
there are
pattern.
a couple studies, and that was the thing is, like, most of the time when these studies were being conducted, they were doing that, minoxidil versus minoxidil with microneedling, but now we have a couple studies where they just did microneedling on its own and confirmed what a lot of people have been seeing for a long time, which is that microneedling has great results no matter what you do. Really, it's a very effective treatment. I think it really should be considered a core part of hair loss therapy.
Okay, I want to change topics just because we're going on this marathon here and shift out. I want to touch on two things first because I know a lot of people are going to want to find exactly not even just to support you, but like to find all the things that you're doing and ongoing because you're consistently doing things. So I have a couple of questions here, especially with the new chapter of HelloSkin, right? Because your current role is chief product officer, correct,
Mhm,
with this company, HelloSkin.
mhm.
How has that transition been from running your own brand with Eviba to leading product development at another company? How's that transition been?
The transition's been great. So right now, mostly we're working on designing like the service stack for the business. I think that when I tell my friends who are dermatologists that I'm working on a med spa, the almost universal reaction is like, I hate med spas. Why would you do that? I hate med spas. As a dermatologist, I hate med spas. I hear that from multiple people,
Yeah.
multiple dermatologists. And I think that's a problem. I think that that's a problem that I can address by making a med spa that is less scammy, that does use evidence-based therapies, that doesn't practice things out of scope, that doesn't do things that are going to potentially harm the patient. And so I think creating a med spa that I think dermatologists would go to is something that I'm uniquely positioned to do. So right now, I'm working on creating the service stack among a lot of other things at HelloSkin, and it's just really exciting because it's a definitely a departure from making skincare products in my own lab with my
Yeah.
own hands, just as the cosmetic chemist, as the formulator. So I'm not formulating the products now. I'm not manufacturing the products or anything, but in a different sort of leadership role where I get to guide the vision of this company to create a and I don't know if I'm gonna even call it a med spa because I think
Mm.
there's such a bad connotation there, but create a skin clinic where people can go and trust that they're going to have better skin as a result, and we're gonna give them
Yeah.
effective, good value treatments. And I think building that trust, building a community is gonna be really important. And it's just an exciting new diversion from what I was doing before.
Okay, so it sounds very different, which is almost funny. I feel like a med spa at its core of what it's supposed to be is supposed to be super helpful. Is it just what it is now is why people are just so turned off by it? Is it just more how it's applied, but not the idea of what it is at a base?
Yeah, well, I think with med spas, a lot of times it's made by people who just want to start a business, you know? So these people aren't necessarily the most educated. And also, you get a lot of people who are interested in aesthetics, which aren't always the best doctors or nurses, or the ones that really
Oh, yeah.
care the most or have the most critical eye. And you have so many different companies making different products and machines and things that are really at best not helpful and at worst dangerous. But the people running the med spas don't have the right kind of mindset to look for the signal through the noise of all of the ineffective or dangerous products that exist out there. They just follow the hype train and end up doing things that they shouldn't be doing to patients. And I think that's a big part of it. There's a lot of things med spas do that can make people look worse long term. Like I said, practicing out of scope. A lot of med spas are doing all sorts of procedures and things that they really shouldn't do and aren't qualified to do. And I think focusing on the core things that don't require a whole lot of training, but can be reliably reproduced at every location that
Mm.
we're going to open and will produce the best results in people's skin is going to be important. So I want people to come to this place, have perfect trust, and then at the end of it, a year later, everyone's complimenting them on their skin, saying how great and how
Mm.
natural they look, and just build customers that way rather than following trends and stuff. And
Yeah.
so I'm really excited to work with a team who really is on with this vision and make something that I think is really needed in society now. Because obviously, if you have a skin concern, the best person to go to is a dermatologist, but access is such a huge issue. We can't all
Yeah.
have a dermatologist do our Botox. There's just not enough dermatologists in the world. So I think democratizing a lot of these actually effective services while screening for the ones that are ineffective or dangerous is primarily what I'm doing.
This does seem like a skill that you are uniquely qualified for. And I'm more excited too because I feel like so many companies and places are started with the wrong intentions. And I feel like,
Yeah.
especially in this industry, skin health outside of like certain, maybe chemical peels or things like that we didn't get to get into that make like an immediate noticeable difference. This is something that I feel like if you stuck to for, like you even said, just a year, that's undeniable proof. You can't fake good skin, like just vibrant, glowing skin
Yeah.
or hair or all these things. Like you can't fake that. And like you said, how your business even started, like people come to all these things. Like you can't, I need to do that. Like, what do you
Yeah.
do? Tell me everything.
Yeah.
So I feel like if it's actually stuck to, and that's why it's even more exciting is like usually the company side is more like, no, we need fast results. We need whatever we can get right now. Not, okay,
Yeah.
let's like really do this right. I feel like in this industry, something that does it right, the potential for that is insane.
There's a lot of things that are getting me excited, but you'll have to wait and see. We'll come back and do another podcast in a year,
I
and
feel
I'll
like in
tell you
this
about all the
industry,
innovation that we've done.
not just self-improvement, but like in science, from helping people feel confident in their skin to exploring new horizons and new research and just curious. If you step back for a moment, other than the reason that started it, what drives you to do this? Like when you think about the grand scheme of life, why do these efforts matter to you? Or what do you find is the meaning or purpose behind this?
I mean, I don't know. I think it comes down to creativity, having a creative outlet for me. And I think that might sound strange when we're talking about skincare products as being a creative outlet, but I've always been that way. If I have an idea, I just can't. And first, if I have an idea, I'll see if it exists so that I could have it. And if it
Yeah.
doesn't exist, I can't stop thinking about it until it does. It's a compulsion. It's like it's a disease. I have to see that thing be produced in reality, or it never leaves my mind. And so I'm just always driven to create the things that I think about. And
Okay.
it's not like I feel stressed about it sometimes. Like it's stressful. Like I'm often juggling a lot of things at once, and I'm very stressed, and it's very difficult. But I can't not do it. It's just a compulsion.
So it really is a literal switch that just gets flipped in your head. That is the philosophy that kind of ties everything together. Because we didn't even get into everything that we've talked about on this conversation. Because it's not, it doesn't just stop at hair and skin. I mean, the microchip in your hand from the chemotherapy treatment on the skin to
Yeah.
psychedelics. Like it's not just this. I feel like this conversation did focus, which I'm proud of us for staying on topic in the hair
Yeah.
and skin health, because our previous conversations are all over the place, which are fun. But it does seem like that's the philosophy then that does tie all of these different randomly seeming places together,
Yeah.
like the outer beauty, the inner health, the altered consciousness, whatever, kind of ties it all together. That curiosity switch, which I'm like, gosh, especially on your plate with school and everything that you're in now. Do you sleep like 4 hours a night?
I try to get good sleep. It doesn't always happen, but that is something I prioritize is sleep for sure.
So until next time, where can people find you for updates? Because like I'm even just saying, like people that are curious about this stuff, that's what I appreciate about you so much is I'm very curious and interested in all of these things. I just don't make the time to go do the level and deep research and exploring that you do. What's the best place that people can stay up to date with you? So when maybe Eviba 2 comes out, don't want to jinx it, but just updates things to learn to continue to do that. Where is the best place to do that for you? Where can people find you?
People can find me, and you can link in the description or whatever, but Eviba Carter on YouTube, Instagram, TikTok. TikTok's my biggest audience, but we're growing on YouTube and on also Patreon. So patreon.com Eviba Carter. And if you sign up to
Ooh.
the Patreon, you can get access to my Discord where I'm very vocal. And I here I'm talking at length, but if someone asks me a question, I have to answer it at length and give all my knowledge. So like it's a very active, even though it's kind of a small community now. I've been really happy. I just started it recently, and a lot of people are in there having good discussions and asking me questions. And that's definitely where you're going to get the most updates about my projects and things. I've been sharing a couple pictures of things too in there. So I think the Discord,
That's
so access to the Patreon is one of the best ways if you want to support me. And even if you don't want to support me and you just want to access the Discord, just like message me on Instagram and I'll add you. I'm not trying to gatekeep if you can't afford the
I'm
Discord or
like, I'm
anything.
signing up right after this because that is exactly what I would be looking for is like that up to date. Because if you're not familiar with your videos, I'm talking to
Yeah.
the audience.
Yeah.
If you're not familiar with these videos, the level of detail and effort put into these videos is on another planet. Like I pride myself on putting so much effort into each video. Yours are on it's in another solar system, which is why I love them so much. But I realize with that, it takes so
Yeah.
long to put videos together. You can't be someone who puts a new video out every single
Yeah.
day. Like
It's
I
like once
fight
it's
for
like a month a month for me. Yeah.
I'm like, I fight for my life to get like 2 a week. And I'm like, yours is, it's just the level is crazy. So
Yeah.
go check it out. I'm excited to see this Discord. I'm sure I'll message you after this so we can get links to like any products that we might have mentioned, like astaxanthin, any of the things that we had talked about today, sunscreen. I'll make sure to get that so we can put it in there. Any closing notes for those listening?
I think just be skeptical of the products you see out there. I think is the biggest one. There's a lot of bad skincare products, a lot of ways to get lost in the hype and end up with worse skin. You know, I think I have good skin and good hair now. I'm 34 next month, and I think I look good for that age, as we talked about. And I think part of it is because I don't fall for the hype. I am very skeptical of a lot of the things that I see, and I stick to the things that have been shown to work, and that is the best strategy. We have really good treatments that have been around a long time. You don't need something new to have great skin. And I think that's the take home message.
If I didn't hear you talk, because you're very well spoken, very well educated, something that young people like, you have to have a certain level of age for it. I'm like, it's almost messed up to say. I feel like you almost look like 25. That is that
Like I
is that
said, I
what
have, I
you
have a lot
think?
of gray hair, and other things definitely will tell my age. But I think that, like I'm saying, I look healthier. I have healthier complexion, healthier skin, healthier hair. I look more vibrant, I think, than most people my age. I think there's definitely ways to tell what my age actually is, but
Yeah,
I think
you're
that
doing well,
compared to other people my age, I look healthy, and that's due to my scrutiny and my using of evidence-based therapies.
doing more than well.
And
That's what
I'm
we'll
getting
wrap.
you on it too.
Honestly, so the amount of times I've been influenced is outrageous with the new products I have. Probably some people from this episode too. But that's where we'll wrap it up. Ta-ta for now, everybody.
All right, see you, Tony. I'm a big fan of your content too. I forgot to say that, but I think you're doing a great job of scientific communication. One of the best on there.
Why, thank you.